everyone. Good evening, all of you who have joined, and many people are joining. So already around 55, 58 people have joined. So I think we can start. So those of you who do not know me, I'm Riaz, officiating head of the Department of Journalism and Mass Communication at Aliah University. I'll just briefly say about why I thought of. So already so many webinars are happening actually, even around COVID-19, this pandemic, which is expected, of course. But I didn't really. There might have been some events. I'm not saying no one did it, but I thought of like what challenges journalists are actually facing and their own experiences of covering the pandemic. Some of them may be directly covering on the ground. Some of them may not be on the ground, but like still covering in different ways. Like say people like Kunal, people like Cyril, who are covering on how the challenges journalists are facing during this time. And also there are some other, like say there are what I've tried to do is not have all political or this kind of reporter, but different kind of reporter, like say our journalist from Sri Lanka in the other panel who covers more of travel and like feature stories, but still we have her to experience what kind of stories, what kind of challenges she is facing. So I think we'll have long discussions, and I'm sure I'll also get a lot of opportunity to speak. So since I have to accept all the participants, so without wasting much time, I'm inviting our own Gulam Jeelani to speak. Jeelani bhai, for those of you who don't know, he works with Mail Today, and before that he has worked with Hindustan Times and with the other papers also, and he has also been on fellowships to United States and won awards also. So without wasting much time, I'm inviting Gulam Jeelani bhai to take over because I'm getting a lot of invitation now to accept. So I'll maybe speak later. At the moment, I have to just accept everyone. So without wasting much time, I'll hand over to Gulam Jeelani. Welcome, Jeelani bhai.
Thank you, Riaz bhai, and hello everyone. My name is Jeelani. My name is Gulam Jeelani, and I go by my second name. And I don't want people to, use my first name. So I work for Mail Today, and I'm a reporter there. I've been a reporter for 10 years, more than 10 years, in fact. And before Mail Today and other publications, I was with Hindustan Times. So, like everyone else in the field, I have been as a reporter, I have been covering for 4 months in Delhi. I've been covering everything that's happening with COVID, and obviously there are no other beats in the field as such. Every story has a COVID angle or a COVID connection. So I'll start with, like most of you would know what's happening in Delhi, obviously because it's the national capital. But I'll give a small overview of what Delhi has been through all these 4 months. I think, if I remember correctly, Delhi's first case of pandemic was on March 2, which was nearly 4 months ago. And today, Delhi has 1.18 lakh cases, which is 1,20,000 cases. And we have had, I think, somewhere around 3,700 or 3,600 deaths. So in the beginning, the cases started slowly building up, and there was our Chief Minister Arvind Kejriwal is a very, outspoken Chief Minister. He often speaks. So in the beginning, he was happy that there are no cases, and everybody else in Delhi. But as the days passed, things started becoming ugly. More cases started coming up, and you might know this Delhi government, the Aam Aadmi Party government, came on health infrastructure plank. Like one of the planks, pre-election plank, was health infrastructure. But what we saw as cases started spiraling, as cases started building up, there was a collapse of healthcare system, especially in the month of June, when we noticed a severe shortage of beds and severe shortage of ICU beds, shortage of hospitals, in fact. And we had cases building up, and then government started coming out of its own slumber and started working for increasing beds, for increasing facilities, for increasing COVID care centers. But the main problem throughout this process has been at the level of communication. Unfortunately, this government is also famous for its transparency plan, but they have not been communicated quite well with the journalists. If I remember correctly, in the last 4 months, Kejriwal have has had, I think, one or two press conferences per se, which means he has taken up questions twice. Otherwise, in all the events, in all the, what they call press conferences, they are not press conferences basically, they are addresses, they are press briefings simply. So one morning you get an invite that Mr. Kejriwal will address the press at 1 p.m., for example, and then it ends up that he doesn't take questions, he just gives a monologue. That has been a big problem for us as journalists. Another problem is data fudging. Data fudging has been a national problem as well, but in our case it started when in Delhi. I'll give a background of Delhi. Delhi has a peculiar problem of multiplicity of agencies. We have municipal corporations governed by BJP. We have a state government which is run by Aam Aadmi Party. We have LG also who reports to Home Ministry. So we have a couple of agencies, like 3-4 agencies working at the same time, which often results in tussle between the agencies. So as we were following what Delhi government data would tell us, suddenly we had this, it was around June, I think first week of June. Suddenly we had this municipal corporation guys coming up and saying that Delhi government is hiding deaths. So there was again a controversy about the deaths. So number of deaths at that time reported by Delhi government was 1,000, but number of deaths quoted by municipal corporations was 2,000. So all these things kept happening, and there was controversy over it. By mid-June, Home Minister Amit Shah intervened. He was, in fact, he visited a Delhi government hospital, which is called LNJP. He visited this hospital before our Chief Minister could visit. So that is the kind of situation that we had. But since then, like, hospital beds have been increased. They have converted hotels. They have converted banquet halls. They have converted other, other places into COVID care centers. We have had a 10,000 bed facility COVID care center in South Delhi, which is managed by ITBP. Then we have another 1,000 bed facility, and also apart from these things that happened, we have a special focus by Arvind Kejriwal government was on home isolation. As I speak to you, out of I think 1,17,000 cases, I think 84% cases have recovered, and we have like 16,000 odd active patients admitted in the hospitals. Sorry, admitted, like who are undergoing treatment. Of these, 11,000 are in home. So most of the patients right now are not in hospitals; they are undergoing treatment in home isolation. So this home isolation push by Arvind Kejriwal government has been appreciated, and it has resulted in positive results. So there was a time, I think it was June 23 precisely, when we had 3,900 cases in a day, which is about 4,000 cases a day. And yesterday we had 1,600 cases. So Delhi, from becoming a COVID hotbed, once it even surpassed Mumbai as a city in terms of number of cases, is today, I would say, relatively at a stable position. If things not go bad, we know that the nature of the disease is strange. It can go bad anytime. But if we talk about present situation, we are at a stable situation. We are like kind of better than other cities of the country. But still, if you talk about the cumulative numbers, Delhi remains at number 3 after Maharashtra and Tamil Nadu in terms of number of cases. As a journalist covering Delhi, like I have covered Delhi before Mail Today also. As I said earlier, the major problem was in terms of getting numbers from the government, from Arvind Kejriwal government. Another problem was the data thing. I don't think there was any better source to get data rather than Delhi Health Bulletin. But when we got Delhi Health Bulletin every evening, it had not enough details. We would only depend on this. We had to rely on Health Bulletin. So there was a demand for having more details about cases, having details about people dying of COVID. There was a demand that the government should break up these deaths into age also. So these things kept happening, and like right now, as I said, we are in a situation where things are looking better than before, better than June 1st. And most of you wouldn't know, our Deputy CM Manish Sisodia had on June 9 estimated that by July 15, Delhi will have, I think, 2.5 lakh cases. But fortunately, we have only 1.5 lakh, 1.3 lakh cases, 1.2 lakh cases rather, which is less than half, which is nearly half of what predictions were. So let's hope it remains like this, but it has been, on and off. It has been good or bad, good and bad at the same time for Delhi. So that is about Delhi. Since so, I wanted to give an overview of Delhi to you guys, and after my turn, I think I should go to Padma Priya, who is, she comes from a different medium. She comes from podcast radio medium, and she's the editor and co-founder of Suno India, which has been doing wonderful, podcasts in this pandemic also. And I would like her to start her whatever she has to say about her experience.
Yeah. Hi all, thank you so much Riaz for this opportunity. My name is Padma Priya. I'm currently based in Hyderabad and I have over 10 years of experience in journalism. I'm the co-founder and editor-in-chief of Suno India. We're an independent podcast platform and we look at underreported and underserved issues in the audio space. And we have roughly around 19 shows. We realized as the pandemic was picking up sometime around February that we will have to shift gears. So as a medium, podcast is a fairly slower medium. And we've also kept our reporting to be in such a way that we are not really in the rush to do any sort of breaking news or any, that there's no rush for doing breaking news.
So, hello everyone.
Please go ahead, Padma.
Right. So we've been producing a lot of podcasts since the beginning of the pandemic. We are somewhere around the 35 or 38 episodes around the pandemic and the following lockdown and the different impacts of it. And I think one of the challenges has been definitely, as a medium, we are not in the breaking news sort of a space, but we also had to ramp up the speed at which we were putting together some of the content to also remain relevant. But quickly we realized that as a small team of 5 members, that would also lead us to get burnt out. And so we sort of slowed down. I think for me, one of the most challenging aspects has been, I'm based out of Hyderabad, I'm based out of the Telangana state. And one of the challenging aspects has been definitely reporting on Telangana. And I think Priyanka, who is here from the News Minute, can sort of vouch for how difficult it has been for a lot of us who are trying to report on the state of COVID in Telangana. And I think it sort of, I resonated with what Gulam Jeelani was saying about, Delhi not sharing proper data. I think here too we have similar issues. For example, the media bulletin format changes every day. And I'm not kidding about this. Like every other day, the media bulletin format changes.
Same.
We are having to rely entirely on these media bulletins for data, of course. And then after a lot of pressure, they did start the COVID-19 Telangana website, which hardly gets updated. There has been a lot of secrecy around data and a lot of, a lot of hesitation and reluctance to answer questions. I'll give you an example that happened at the beginning of the pandemic. So sometime around February, March, when Hyderabad just had like 2 or 3 cases, and there was the first death that had happened in India was of a man from Kalburgi, and his family members went on record and talked about how this man was brought from Kalburgi to Hyderabad and was denied admission, I think in 8 hospitals, and was also denied a COVID test in the Gandhi hospital, which is a government facility. And following that, a bunch of us in the media group, which till then was like a WhatsApp group where we could ask the director of public health questions, we asked a bit of questions about about this person's narrative. Like we asked what happened, like did they come to the Gandhi hospital? And the DPH himself gave 2 very varying accounts. And when we pushed him a bit harder, he just changed the WhatsApp settings to admin can post only, and all of us could not ask questions anymore. And a bunch of us who asked some questions were basically denied being given any sort of information post that. So this has been sort of the level at which we're having to operate and report from, report on. And a lot of the times, the kind of information that we are getting are obviously from sources that we have built over the last couple of years. But there is only so much reporting as a journalist that you can do, or I as an editor can be okay with saying that sources said this or sources at this first place said that. At some level, just because of the declining credibility in media, it's so difficult for us to only do source-based reporting, and we ultimately do need official quotes. For example, I did an interview in Telugu. We also have a Telugu podcast, news
Yes.
podcast. And as part of the Telugu news podcast, I did an interview with Junior Doctors Association, members of the Junior Doctors Association, T. Judah here, about nearly, at that point of time, nearly 60 to 65 junior doctors, PG, interns, residents had been infected in Usmania General Hospital and its affiliated hospitals. Now, Usmania General Hospital is one of the biggest hospitals in the city. It's a tertiary hospital, and has been again back in the news in the last few days because of the wrong reasons, because of flooding and infrastructural issues and just limited resources available. And I did this interview, and they said that these are the problems that we're facing. This was around the same time when Gandhi students were Gandhi doctors were protesting. And I went back to the health department to take their response, and it was just complete silence. All that they sent me was that they just sent one quote saying that we will be addressing these issues, and they just refused to come on a call, refused to give an interview. So they basically are very, very reluctant to give. So how do you then report in such a scenario? So a lot of the reporting for us has been, we are trying as much as possible to do it on record, but that has also limited my ability to do on record interviews, because for example, I'm sitting on a bunch of story leads, but I cannot go forward on them because people are not willing to come on record. And like I said, how much do you report on off record? It's just not possible.
Right.
And this has been
Padma, would you? I'm sorry to interrupt. Would
sure.
you continue after this, or can I go to other panelists, because
You
we
can
can
go to other
continue
panelists.
discussion later, right?
Yes.
Because we have many things to discuss with you, right?
Absolutely. Yeah.
Yes.
Yes.
Why you are not audible? You are not audible. You are saying something, I guess.
I think Padma has to leave, so I
That's
think
why I asked. If you want to continue right now, I don't
then
have any.
I think
You can come back later.
she can wrap up in 5 minutes. I think
Yeah,
she
you
will
can.
leave
Very well, you can
if
wrap.
she has to leave, then it will be a problem.
Sure.
Yeah, please,
No,
please
I
go
think
ahead.
these have been some of the key challenges, at least for some of us based out of Telangana. This has been a real challenge. And also the kind of language. I just want to talk a bit about the language that's being
Sure.
used by our political leaders. And I'm not just pinpointing Telangana, because leaders across India have been using this kind of stigmatizing language, where they have, since the beginning, have been using very I would say, very insensitive language when talking about people who've been infected with COVID. Now, at the end of the day, you simply cannot afford to do that. And surprisingly, when it comes to them, if one of them get infected, the kind of conversation that happens is obviously like, samaj seva kar rahe the to unko ho gaya, sort of a conversation. Whereas when somebody got infected, it's not anybody's fault when someone gets infected. Anybody could get infected. But anyway, so I think, like, for me, the language that's being used by, at least early on, that was being used by a lot of the leaders, whether it's CM level, whether at a CM level or at a MLA level, I think has been really terrible. I just want to leave you all with one short example of how difficult it has been in Telangana for a lot of people to get tests. And if you can see, even today, Telangana has the lowest testing rate, one of the lowest testing rates in India. I want to just share my own personal experience of trying to get a COVID test in Hyderabad. I had all the symptoms. And I went to the government hospital, and I was turned away from there. And I was actually told, "You're young, you will survive. Nothing will happen, even if it's COVID." And for me, while that was very alarming, just the tone that was taken, what was even more alarming was to see very elderly people and pregnant women being turned away by Telangana government officials from being tested. And I'm talking about sometime in mid-April when all this happened. Subsequently, I did manage to get the test, and that was only because I shared my own experience on Twitter, and that went viral. And I'm like so aware of how my privilege also got me the test. But what followed after that was even more horrifying, where I was actually not told that I had pneumonia in my lungs, and I was just shuttled from one hospital to another government hospital. Now, I am an educated, articulate person who can actually ask, and who knew whom to call and whom to ask for stuff. But for a person who does not have access to these kind of resources, it's been a nightmare. I can tell you, it was nightmare experience for me to have been sent home just because I got one COVID test negative. I was not given the second test. I wasn't told how my actual situation of my lungs was. And that just kept me thinking about how bad the situation was. And I've been sort of trying to sort of do my own bit as a journalist and also as a person to talk about these things. But it can get very, very frustrating. And I think I just want to sort of leave you all to also think about how frustrating it can be even for journalists. At one end we are being abused for not doing enough, or we're being told that you just use sources and you write up stories. It could be all fake. But we know on ground what the reality is. We know ki kya ho raha hai yahan pe, but we still cannot, because we are in this dilemma, right? It's an ethical dilemma as a journalist. Do you go ahead and just write a source-based story, or do you just let that story go? How do you raise awareness in the public? So I think, and I'm sure a lot of other journalists here will also resonate with how difficult and how challenging just getting proper data out of any state. I think only Kerala and Karnataka and maybe Tamil Nadu to some extent have been very proactive about the kind of data that they're sharing. But I think for others, it's been a Herculean task. Like if Andhra Pradesh is claiming 10 lakh tests that they have done, what is the breakup of those tests? How many are RT-PCR? How many are antigen kits? So it's for us, like, I think it's just good for people who are here to also understand the challenging situation that COVID is presenting, especially in terms of data, especially in terms of sources, and even from the point of reluctance of governments. So just,
Padma, since you leave,
sure.
I have just one question to ask, and maybe Kunal can ask if he has some question. Is that you work in a new medium like the podcast medium? So since the pandemic, do you see any change in the say in number of audience or participants who are like following more of your website? Like, is there any change or like downfall or maybe rise?
No downfall. We've actually seen our numbers triple, I think. We've seen a huge increase in listenership. And I think what's also helping us is that some of our podcasts are being shared on WhatsApp, because a podcast size, the audio size, the file size is very small. So it can be shared on WhatsApp easily. So that's also helped us quite a bit in terms of getting more listeners onto the platform. So yeah.
Kunal or Jeelani, if you have something to ask.
Padma, you mentioned what are all difficulties you face, but as Riaz bhai rightly said, yours is a different medium. Like it's a new medium, we would say, and not many people know about podcasts, right? But it is emerging medium, and I remember there was a story on your website. It was about how it's a very sensitive story. It was about maternal health care. It talked about how institutionalized deliveries have gone down, right? So how do you, like, these are stories which basically, this is a story which nobody is touching because everybody is going for COVID and other COVID related stuff. So how difficult it is for you staying in Hyderabad to do these stories which have a which will have a long term impact later on the maternal health care especially?
Yeah, I think the maternal health care one, which was our more recent episode, was an interview with Dr. Aparna Hedke, who has been doing some fabulous work on ground. And I think for us, like, and I think it would be wrong for me to say that others didn't do it. I think others have also covered this aspect of maternal health care. But I think just because...
I mean, generally.
Yeah. But I feel like the topics that we do touch are topics that are not considered...
That's my point, exactly.
They're not sensationalizing, or they're not very... I mean, actually, you would have people say, kitna dry subject hai. But the challenge is for us to make that into a very interesting sort of a conversation-led sort of, more like a speaker at conversation-led sort of a episode. And we do actually do a lot of reporting. So in the initial, after the lockdown, we've actually used WhatsApp voice notes to do an episode on the challenges that doctors in Kashmir are facing, because it was difficult for me to obviously get them on a Skype or a
there's 2G problem.
Yeah. So for them WhatsApp was working. So I said, you know what, guys, मैं आपको questions भेजूंगी, आप मुझे सिर्फ जवाब WhatsApp voice note में भेज देना, and I put together an episode like that. So it has its own challenges. Similarly, we did an episode with farmers, from after the lockdown, how they were impacted from Andhra and Telangana, and I did the same thing. I asked them to send in their voice bites. And I think what gets people going about even coming onto our show and to speaking to us is actually that we are putting their voice out, right? So irrespective of who they are, as long as they're bringing matter of substance, we are putting their voice out. And for me, I think that has a much more deeper impact. Sometimes with some stories, when you hear it, it makes a larger impact. So yeah, I think this has been the way we've been.
I'll ask you one more related question. I
Okay.
just wanted people to know, because many people who would be watching this webinar wouldn't know that podcast is a different medium. So how has the response been of your audience? As Riaz bhai pointed earlier, response before COVID and response after COVID. Like, is it emerging as an acceptable medium, or whatever it is?
Yeah, like I said, we've actually numbers have actually tripled in the last few months. And what has been really helpful and what listeners are also saying is that, now that so many of people are also working from home, or, just doing other things at home. So for example, we had a listener tweet out saying that, as I'm chopping vegetables, I'm listening to a Suno India podcast.
Very interesting.
They can't do that with a video, or they can't read an article while chopping onions. Whereas with listening, that's the thing that you do. So we've got great response, and we are very thankful to all our listeners for this. Yeah.
Thank you so much, Padma. Anybody has any question? I would want, if anybody wants to ask.
Yeah.
Just one question we can take, maybe.
Yeah, we can take one question.
Kunal, are you there? Do you want to ask something?
Yeah. If I may. Sir, can you hear me?
So those of you don't know, those of you don't know, Kunal Majumdar works with Center for the Protection of Journalists.
Committee to Protect Journalists, not Center.
Okay. Sorry.
So, Telangana CM has also come under a lot of, criticism for the way he has handled the press when it comes to coverage of COVID. And could you elaborate, or, we have around 114, and many people don't know, like, how high-handed he has been with press on this issue. If you could elaborate.
Sure. I don't think it's linked to COVID alone, Kunal. I think from the beginning, unfortunately, I think over the last 4-5 years, what has happened is that there's been a complete erosion of press freedom in Telangana. And it's quite an unfortunate situation, not just press freedom, but also if you look at a huge clampdown on protests here. And it's really ironical considering how Telangana has been birthed out of years or decades of protests. And I have personally covered the Telangana protests, and I know the kind of protest movement and what led to this, to Telangana emerging. And it's really unfortunate that KCR himself, who led so many protests, has now clamped down on this. And he also used the press to the maximum, during the movement. But especially during COVID, I think what has been really startling, he was doing these regular press conferences, and if people would ask him questions, he would actually, yell or mock them, or basically threaten them. Like he actually told one journalist through the press conference, there was a report on how there was a shortage of PPEs and masks for doctors, and the next day there was a press conference by KCR in which he basically said, I know who you are, and I know why you're writing all this. I know this is all political, and in Telugu he basically said in short, he basically said, "Main dekh lunga tujhe." So that's basically been the way he's been clamping down on media. And frankly, I've been out of Hyderabad for 5 years. I was based in Delhi. So, I'd also, I had not realized how bad the situation had become until I came back here last year. Even in terms of English media or Telugu media, there is literally not many people left here who challenge Telangana or who write anything even slightly awry about him. And if you do, then he will figure out ways to make your life hell. And I think only few independent platforms, and I would actually like to sort of give a shout out to the News Minute. I think the News Minute has been doing some incredible coverage from Telangana and from South in general, but also from Telangana. So yeah, it's been very pathetic situation, Kunal, to answer your question. And I think it needs to be highlighted more, and he's just, nicely operating under the radar. But he's a very persuasive speaker. I mean, you listen to his press conferences and you'll be like, this man has like my best interests, that's how he speaks. So I think this is where all these oratory skills, I guess, come into being for propaganda.
Basically, he's a good politician.
Very good politician.
He's a good, right? Like our Arvind Kejriwal, right?
Yes.
I think
Anybody
that
else?
I think
Yeah.
that is with all state leaders. Like we focus so
True.
much on how central government tries to suppress press, but you see even
True.
Nitish Kumar, for that matter, even like in our state and in all states, the regional media is managed very well actually.
Right. Right.
Anyhow, thank you so much.
Thank you, Padma.
You are not well, but you still joined, so we are really thankful to you.
It was very informative for Padma. Thank you so
Thank
much.
you.
Thank you
Thank you
so
so
much.
much.
So
Thank you, Padma. So,
I
Riyaz
think
bhai, can I? The next,
next
okay.
your
After Padma, we have another very good journalist and a good friend, Parth from Mumbai. So Parth has been doing wonderful work. I should, appreciate him for his work. Today only there was a story about Professor Rao. We know how he turned out to be COVID positive, and there was a wonderful story by Parth. If you guys have not read it, you should read it. It has published in Newsclick. It said about how his family is saying that he was found lying in urine-soaked bed. It was I woke up to this story. It was so bad. Anyway, Parth, you have been Parth has been, everybody of us knows, he has been writing on agriculture, on migrant crisis, on healthcare in Maharashtra, and we know Maharashtra is the worst affected state with COVID. So Parth, over to you. Please explain your whatever you have been doing and your experiences all these months.
Thank you. Am I audible?
Yeah. Please go ahead.
Thanks a lot. Thanks a lot for inviting me, first of all. Yes, I'm based in Mumbai, and my state, Maharashtra, is at the top of the pile in India with nearly 3 lakh cases. But I think we should also look at how these cases are divided in different areas of Maharashtra. So more than 80,000 cases are in Mumbai. Besides that, Pune and Thane are other hotspots. So I think the state has so far been successful in avoiding that spread of coronavirus into the hinterland, where the healthcare facilities are abysmal.
Very bad.
In Mumbai, I mean, at least in rural Maharashtra, people have started getting back into their farms. Things are slowly getting back to normal. In Mumbai, the spread seems to be getting worse, because what is worrisome is the fatality rate in Mumbai is almost 6%. But at the same time, according to a report in Mumbai Mirror, critical cases have gone down. So there's a bit of a pros and cons there. But I think overall, I would say the pandemic has exposed our healthcare, Mumbai's healthcare, and something that the BMC has not paid any attention to in the past 20 years. We have seen several reports of private hospitals overcharging patients. Many of them have not admitted patients in Mumbai, and while public hospitals in the city are not in the best of states. Over the last 2 decades, Mumbai's population has doubled, but the public hospitals have not really increased in the same proportion. So, I mean, if you look at the population of Mumbai and look at the public hospitals in Mumbai, there's a gross mismatch that you'll come across. So I think the fact that the BMC, which has been ruled by Shiv Sena over the past 3 decades, I think it has ended up exposing its own chief minister.
Very interesting.
But I think the examples of Dharavi and Malegaon they show that the virus can be contained, because when the first case of coronavirus broke out in Dharavi, I was in Dharavi doing reporting on another story, and I remember the reaction of people. They basically skipped a heartbeat, and everyone thought it would spiral out of control. But remarkably enough, they have contained it in Dharavi. I did a story on that for the Los Angeles Times. And when I spoke to Kiran Digaokar, the officer in charge of managing COVID in Dharavi, he said we started chasing the virus instead of the virus chasing us. So basically, they teamed up with local private practitioners and aggressively conducted surveys in the slum that basically helped them isolate suspected patients and stall the spread of the virus. There was also a lot of paranoia and taboo around it initially. So basically, that they addressed that as well, and that's why people also started coming out and reporting more frankly and freely instead of being scared and hiding information. And I think if it's possible in Dharavi, then it's probably possible in most other. But more than that, I mean, I've been looking at the migrant crisis. I mean, this is the overall situation in Mumbai and Maharashtra. We'll see how it unfolds over the next few days. The cases are rising, but as they will. But I've been looking at migrant workers in far more detail over the past 3 months. Actually, not just in the past 3 months, but even before that, I've been looking at rural India and agrarian crisis, and I want to talk a bit about that. The more
please go ahead.
Detail about that. Basically, what happened after 25th March was we robbed them of every ounce of their dignity. We reduced them to beggars even for 2 meals a day. That humiliation and uncertainty compelled them to sort of return to their villages in many cases, and it became a nightmare. At any cost, they just wanted to get home because there was a lot of uncertainty about even whether they'll get 2 meals a day. And in many cases, it turned out to be one of the ghastliest stories that you could come across. Around mid-May, 16 migrant workers were crushed under the train in Aurangabad in their sleep. They were on their way to Madhya Pradesh, and uh, as ghastly as that incident was, our first reaction was to ask why the workers had been sleeping on the track and not on the platform. I spoke to one of the survivors the day after, and he said we didn't on the track. We had been walking for 8-10 hours straight, and we sat down to take a break, and unintentionally we fell asleep. But our first reaction was to blame the workers for their death and not question the company that did not pay them their rightful wages or the government that failed to reassure them when they were most vulnerable. So I think what we saw after lockdown when it came to migrant workers was just a manifestation of the apathy and indifference with which we have sort of treated them for years before the lockdown. I mean, even before 25th March 2020, they survived in appalling conditions. They worked too hard for too little money. They were exploited with impunity by their urban employers. Ahead of the 2019 general elections, I had the opportunity to spend 3 months on the road through the states of Chhattisgarh, UP, and Bihar, and just to get a sense of the unemployment in Hindi belt. And every major city or even a small town in these three states had 2 or 3 junctions which were called labor chokes. Every morning, thousands of workers living within that 120, 200 kilometers of the town radius would arrive at the labor chowk in the hope of, finding a day's work. They would take the train at 4 in the morning and land up at these chowks. They would have a cup of tea, say a silent prayer, and then wait for someone to hire them. Now, when the contractor eventually arrived to actually hire the labor workers, many of them had frantically gathered them, encircled the contractor, and desperately hoped that their face would be noticed. Now, the contractor would be looking for 10 or 12 workers. He would be surrounded by like hundreds of them. He would ask them what would they charge for the day's work, and one of the workers would say, मैं 300. Another would quickly say, मैं 250 में कर दूंगा साहब. The third one would chip in and say, मैं 200 से ज़्यादा नहीं लूंगा. That is how we have dehumanized migrant workers over the past few years. And this is how they've been living. But, to be honest, neither the civil society nor the mainstream media have bothered about it because it ensured cheap labor for rich people in cities. If the migrant workers do not watch the 9 p.m. primetime shows, nor do they pick up our English newspapers in the morning, so we didn't care to rock the boat. We spoke about migrant workers for the 2 months after 25th March. We spoke more about them after 25th March than we did for 10 years before the lockdown, except for an odd report romanticizing the invisible, quote unquote, invisible force that keeps the city ticking or the country ticking. It took something as drastic as a lockdown for us to wake up to their existence, even though they had been right in front of us all along. The people toiling at any construction site in cities are migrant workers. The electrician that we call when a fuse goes off,
Right.
that person is a migrant worker. The plumber who fixes our leaking bathroom, that's a migrant worker. The people who pull rickshaws to take us to our metro station, that's a migrant worker. I mean, the Ubers and Olas we book after late night parties are driven by migrant workers. My question is, why do we look at migrant workers only when their world completely falls apart? We were forced into, sort of shamed into covering migrant workers after 25th March 2020. We wait until they fall off the edge. I think we should examine what keeps them at the edge all the time. Why can't we report on the circumstances that force them to be perpetually in a situation where they are just one policy decision away from being on the road? The stories that we did after lockdown were necessary. I'm not denying that. But we now need to sort of take a step forward and contextualize that migration. The sheer scale of the migration, basically, I think should make us pause and wonder, why do so many people leave their families and friends and farmlands behind and decide to live under a bridge in Mumbai or Delhi to make their ends meet? What compels them to escape their comfort zone and slog day in, day out for 300 rupees a day. I mean, people living in cities, you and I are not as charming as we think we are. So definitely they don't come there for us. So why do they migrate in such a large scale? And I think that is something that we need to address now. At the very core of migration is the widespread rural distress across India. Between 1995 to 2015, more than 3 lakh farmers in India have died by suicide at the rate of 40 per day. Between the censuses of 1991 and 2011, nearly 15 million farmers have stopped being main cultivators to become full-time laborers. It essentially means the farmers that employed agricultural laborers are ominously decreasing, while the number of laborers that depended on farmers for employment is exploding. Even in one of the sort of relatively better off states of my home state of Maharashtra, there are like 14 million rural households depending on manual labor, and only 14 million households. There are 14 million rural households in Maharashtra, and 6 million of them are solely dependent on manual labor.
Right.
We come up with Manrega to address the situation of people finding work in rural India, but that's not been enough. I mean, according to its website, only 15 lakh out of those 6 million rural households were employed under the scheme of in Maharashtra in the financial year of 2019-2020. That too, the average days of employment provided per household stood at 40, when the promise is to provide 100 days of work, which basically explains why rural residents are desperate to migrate to cities. There is a gross mismatch between the number of people looking for work in rural India and the opportunities available, largely because yesterday's self-employed farmers are today's laborers hoping to find a worthy employer. Now, and that's happened because almost all the crops cultivated across rural India are failing to sustain the livelihoods of Indian farmers. They are grappling with climate change, inflation, and dwindling crop prices. They have therefore found it safer to abandon farming and move to cities instead instead of dealing with that uncertainty. Over the past 4 or 5 years of reporting from rural areas, I've not met a single farmer who wants his or her kid to continue farming. Now that's fine. I'm not one of those who believe that farm kids should remain in farmland, that they shouldn't have aspirations. But the trouble here is that they prefer to be drivers, chauffeurs, construction workers, and security guards to being farmers. The choice to not be a farmer or to not live in villages does not stem from aspiration. It basically comes out of sheer desperation to survive. We have destroyed the livelihoods in villages, and that is why they have been driven to migrate to cities at any cost. And when agriculture sort of collapses, it has an impact on the entire rural economy, because there are people indirectly dependent on agriculture as well, like the cobbler in the village or the carpenter in the village, because farmers are their consumers. And when the farmers' purchasing power goes down, it has an impact on the entire sort of rural economy. And the employers in cities are sort of aware of it. And that is why you see the kind of exploitation that you do. Besides agriculture, handicrafts and handlooms employed the largest number of rural Indians. There are boatmen, fishermen, toddy tappers, toy makers.
Right.
They're all going under one after another, leading to massive unemployment in rural India. And because the skills they have are being rendered irrelevant.
I'm sorry, Parth. I'm sorry to interrupt. If I may ask you to cut it short by 2-3 minutes, because we can continue the discussions later on, because we have other panels.
Like one last point to make. So
please.
Yeah, I'll just give one example of a man I met on the Mumbai-Nashik highway. He was basically trying to migrate around mid-May or somewhere. He had lost a leg in a bike accident in 2012, and he was going back home 1,200 kilometers to Madhya Pradesh on his Honda Activa. The scooter had a sidecar, but he did that journey with his wife and 3-year-old kid. It was an extremely dangerous journey. And he was scared. He told me that, but he said, I promise to call you when I reach home, and I won't ride the scooter after 10 at night. He did keep the second of his promises. My phone rang on the morning of, I think, 19th or 20th May, and he said, we have reached. It was a extremely dangerous journey. So I asked him whether he would come back to Mumbai again, after suffering the way he had through the 50 days of lockdown. And I expected him to say no, or at least ponder over it for a minute, considering what he had gone through. But he said, I will have to return once everything settles down. Most migrant workers come to cities not because they have because they love being in cities, but because they have no options back home. So I think that is the social contract that we need to address going forward. I mean, after having covered the hardships of migrant workers for 2 months after lockdown, it is important for us to take a step further and review this social contract and examine how we got here, uh, and exactly what keeps the migrant workers at the mercy of urban employers. I think I'll wrap up here, and then we can take.
Yeah, please. Thank you so much. Thank you so much, Parth. For those of you who don't know, Parth is a Ramnath Goenka Award and other awards also, international awards also. I forgot to mention it earlier, and he has been doing wonderful work covering, rural India. So next on our speaker panel is Priyanka Thirumurthy. She works for News Minute. She's in fact the bureau chief of in Chennai, and for us in Delhi, News Minute is one of the very few, places, one of the very few websites where we get news from South. So Priyanka, over to you. Please start your experience and share your experience and what all situation in Chennai and Tamil Nadu in general is.
Hello, I'm Priyanka, and I'm here to talk about Tamil Nadu in particular. Can you hear me?
Yeah, we can. Please go ahead.
Here to talk about Tamil Nadu in particular and South India in general. And I think I'll have to start by giving you a small brief on how exactly the situation in Tamil Nadu is. So let me just say it very obviously. Like Parth said, there is good news and there is bad news, as Jeelani said as well. So Tamil Nadu, as you all may know, has the second highest number of cases of COVID-19 in the entire country. As of yesterday, total number of cases stands at 1,56,369, and there are 2,236 deaths in the state. And of this, Chennai alone contributes to 82,128 cases. And after 3 lockdowns yielding little to no result, the capital was in a complete lockdown between this June 19 to July 5th of this month. And this has resulted, of course, in a significant change in Chennai's numbers. So this is where the good news starts. Like for starters, Chennai's recovery rate has seen a steady rise over the past 4 weeks from 53.10% on June 18th. And also the discharge rate has climbed up to 58.73%. And as of yesterday, 80% of patients in Chennai have recovered. And the 17-day lockdown has also allowed officials to bring down the daily cases. While these increased from June 18th and touched a peak of over 2,000 cases on July 2nd, the effect of the lockdown has been witnessed in Chennai for sure in the recent days. And as of July 9, the district's daily cases had actually fallen to 1,200 cases. But let me tell you, unfortunately, that's where the good news ends. And if you look at the numbers or even the facts or what is happening on ground, genuinely, like it's going to be very difficult going ahead. Let me tell you how the government here works. So initially, the government tried to downplay this. In March 9, when Chennai saw its first case, it tried to downplay the whole issue. Then, of course, we had the Tablighi Jamaat cluster coming in, which actually contributed to over 2,000 cases in the state. This was the first huge shock for the state. And even then, the bureaucracy, the government, they all remained very muted in their response. Even at that point, I'm afraid to say they didn't actually realize how serious the situation was, because we had our chief minister tell everybody in April that within 3 days, the number of cases in Chennai will become 0. The number of cases in Tamil Nadu will become 0. Within the next 3 days, the cases pretty much doubled. So that's what happened here in Tamil Nadu. And like cases after that only kept increasing from 500 to 1,000 to 1,000 to 2,000. And now we're standing at over 150,000 cases. So this is what is happening in the state. And if I want to take you back to numbers, let me say how it's going to look pretty bleak for the state. So let's take a look at Chennai has opened up again. Pretty much there are, of course, a few restrictions in place, but just the fact that they've opened up means that the cases are going to increase. Till the last 3 days, of course, the cases had plateaued at 1,200, but just yesterday, we had over 1,500 cases again. So this means the effects of the lockdown are possibly wearing off. So that is what we need to take into account. And to make matters worse, the virus is spreading to other districts. So in around May, what they realized is that Chennai had created a second cluster, because towards the end of April, they called for something called a complete lockdown. And what happened in this complete lockdown is, just before it began, people started rushing to the Coimbatore market in Chennai, which is one of the largest markets in Asia. And just the Coimbatore market has contributed to almost 3,000 cases in the state. That is the second cluster. that Chennai has contributed to. And so from here, the districts close to Chennai started recording 200, 300, 400, 500 cases. And now, to make matters even more difficult, you have the western region and southern regions. Now, these have also started recording more cases. So you may ask how this happened. Once again, the government said, okay, we are going to announce yet another lockdown. And just before this lockdown, people started rushing to their hometowns. Because let's face it, the cost of living here is much higher than, let's say, in their own villages. And people who come here for work, it makes no sense for them to stay here alone. So they want to go back to their hometowns. And then there are migrant laborers as well who want to go back to their hometowns. The ones who were still caught in the city, they left. So this meant that they took cases with them. So there are some very huge mistakes that Chennai has made. For instance, Madurai and the 8 other districts in the southern region have recorded more than 100 cases on Wednesday alone. In the western region, you've seen a threefold increase in cases since July 1st. So this is the kind of cases that we're looking at. And in the central region too, the cases are spiking. So as far as numbers are concerned, this is what is happening in Tamil Nadu. But I think we should go further than numbers and look at the human aspects of what is happening. And there is a very big question in the state right now of economics versus ensuring that the disease does not spread any further. So right now the government is in a huge fix because let's take the Coimbatore market itself. Traders across the state, not just Coimbatore, they are saying, hello, open up our markets. Farmers are struggling because they're unable to sell their produce. Traders are struggling because they're not able to get enough people to come to the markets and buy, and the temporary markets are not good enough for them to sell their produce. There is no place for storage, etc. But the government at this point is kind of cagey about it because their first cluster, just which formed in Chennai, is from Coimbatore, and they faced enormous amount of criticism for it. And even if they do open it up, they have to open it up very, very smartly. And in addition to this, of course, across the country, you're seeing business owners, daily wage workers, and the like face a sharp dip in incomes, and in some cases even bankruptcy. So that's something they need to take into account. And the second aspect that I need to talk to you about is domestic violence. So the thing about this virus is it doesn't just affect the sphere of health. It affects every single aspect, be it crime, politics, anything in the state. So just today, I reported a case of a dowry death. So this happened in a district called Kadalur in Tamil Nadu. A 26-year-old woman who was married for the last 2 years to a 28-year-old man, she took her own life. So before she took her own life, she made several videos explaining why she did this. And what investigators found was that her husband, who was actually an IT employee in Chennai, had lost his job due to the COVID-19 pandemic. And after he lost his job, there was no source of income in the house. And he began to pester her. He said, go bring money back from your parents. Go figure out, like bring back gold, bring more dowry, or I'll leave you. So those are the kind of threats that the woman was facing. And finally, she took her own life. And let me just tell you, like in this particular aspect, I'm not saying that the husband is devoid of any crime, but we also need to take into consideration the COVID-19 pandemic here, which has led to more stress on women in several households throughout the state. Domestic violence has become a huge issue. I know for a fact that my house help sister she took her own life just a couple of days back because she was facing enormous amount of domestic abuse. Earlier, women could leave the house, they could actually get out, like somehow escape their abusers, but they're not able to right now. People on helplines are actually telling us that we are not getting as many calls as we used to earlier because the abusers are right there in the house. So women are unable to actually call us and tell us exactly what is happening. So we need to look at the human cost of this particular pandemic in the state is something that I feel it is very important to focus on this part. It's very like easy to talk about numbers and just data as journalists, but we need to see how people are suffering because of this pandemic, be it like women, be it your daily wage laborers. That is what needs to be brought into focus, I think, as journalists. And of course, I also covered the lack of infrastructure in the state. And we actually broke a story on how private hospitals and government hospitals, of course, government hospitals have the space to expand, but private hospitals in the city did not have enough beds for COVID-19 patients, number one. And number two, the private hospitals that they had listed in their official dashboard, the government, half of them either didn't have doctors or staff, and the other, and a couple of more of them actually didn't even have the infrastructure. And some more of them said, we're not even a COVID care center, we don't know why the government has listed us. We don't have the infrastructure or the doctors for it. So this was the response we got. And in fact, when we put out this news story, we got like a notice from the police under the Epidemics Act. So that's one more issue in Tamil Nadu. The minute you go beyond, let's say, you toe a particular line, you start, the police and the government start questioning your work. And then, of course, there's the Epidemics Act, which has proven to be a very useful tool for them to send notices. Another editor from a website in Coimbatore was in fact arrested under the Epidemics Act for 2 reports. And the truth is that everybody had reported that. So this is their way of kind of keeping a control over the media, keeping a check over the media. And the areas where they kind of threaten the journalists are places where a particular minister has a hold and he wants to make it look like there are no cases. But the truth is, nobody really knows where this pandemic is going from here. No, none of us can actually predict what is going to happen. Because let's face it, the Nilgiris district in Tamil Nadu, we had close to no cases there. And just 2 weeks ago, we had one person who works as a PRO in a company there. Just one person was responsible for 103 infections in the district. And this was because they opened up public transport there. He'd been traveling to Coimbatore and Nilgiris. So we need to, first of all, acknowledge that even as journalists, no matter the data we receive, no matter what, we don't know exactly what is going to happen from here.
Right.
We predict everything that is going to happen from this point. And to say that we can is actually, it doesn't make any sense at all. We are, and number two, the data that we receive, they cannot blindly believe all the data that we receive. Like I said, there are over 2,000 deaths, but we suspect that there are even more. Because let me tell you, we did a story on how the corporation and the Department of Public Health in Chennai, at least, is not actually cooperating with each other. Because they are both working under different ministers who are having, according to sources, ego tussles. And because of this, there are over 200 deaths that are unaccounted for, that the corporation has registered, but the Department of Public Health has not. And of course, doctors have been beating their chests about how there have been not enough PPE kits, not enough protection for doctors. Almost all of our government hospitals here in Chennai are hotspots. So even the question of going there and trying to cover a story has been ruled out because of this. When I call doctors and say, can I come talk to you in the hospital? Their first reaction is, please don't come, this is a hotspot. You come to the OPD and you're going to get infected. So there are so many restrictions for us to cover. And like Priya had said before me, on top of these restrictions, there's the fact that we can't completely believe every piece of data that we get. And here, I'm not saying that the government is fudging data. What I'm trying to say is, even for them, the pandemic is new. This is a very new situation for the government as well. They've not faced anything like this.
Priyanka, if I may ask you to wrap up for now, because we can take more questions later. And and I thank you for this elaborative overview of things in Tamil Nadu. I just wanted to highlight another point, like data fudging is one point, data manipulation is another point, right? So most of I don't think anybody, everyone in this panel and everyone who is watching this webinar is aware of the fact about testing. Like every day, for example, in Delhi, now Delhi government, publicizes the fact that we have been doing exceptionally well in terms of number of tests per day. But there's a catch in this test, which common people wouldn't know. We know because we keep following other states also. Like for example, today, so Delhi government is saying we have done around 21,000 tests. But the catch is that out of these 21,000 tests, 15,000 are antigen tests and only 6,000 are RT-PCR tests. Now the problem is antigen tests is there is a larger chance of a bigger chance of fake negatives, and anybody who is tested negative in antigen test has to be tested again through RT-PCR test. So again, if we have done 20,000 tests, we should know how many of these. We should know how many of antigen tests were negative, how many of were positive, how many of them were tested again in RT-PCR. So that is where the catch is. So the governments are giving us numbers and we just read the numbers, and if you read between the numbers, there is another manipulation. Thank you so much, Priyanka. So after Priyanka, I'll go to the next speaker, which is he's from West Bengal. His name is Riju Basu. I have to take the name carefully because my boss's name is Riju Bose. So the names are similar. So Mr. Riju has been working with Anand Bazar Patrika for last 2 decades. He has been covering West Bengal, Jharkhand, and Odisha. So I would like him to come take over and start explaining and give us an idea about how things are in West Bengal and the region.
Just before Rijuda begins, because more than half of the audience are from Bengal, so he
Okay.
works with a Bengali daily, so I'll request him maybe to speak in a mix of Bangla and English. So I know people from outside Bengal may have some problem, but people for Bengal, it will be easier to understand. So
No
Rijuda,
problem.
welcome. Is Rijuda there?
I don't think he is.
I think he was there. I saw him logging. I think he. So maybe we can go to
Okay.
Sam and
So
then we'll come back.
sorry, so we may have Riju later, and right now I'll go to Cyril. Cyril is there, right?
Hello.
Please mute your mic. We will take questions later. Please mute your mic. Otherwise, I'll have to remove you.
Hello, can you hear? Okay, all right, done.
Yeah,
No,
Riju is here.
Rijuda is there.
Please, welcome back. We lost you somehow. Riju,
just a second.
I am there. Maybe there was some technical snag.
Okay. So Riju, I'll just start again. I just told them that you are a special correspondent with Anand Bazar Patrika, and you come with. Can you hear me now?
I was there throughout, but I don't know. Somehow I wasn't able to talk. Okay.
So would you mind starting your experience and whatever situation is there in West Bengal?
So I carry on my presentation in both English as well as Bengali, as Riaz has said.
Perfect. Please start, Riju.
Actually, although the topic of this webinar is covering COVID-19, the actual scenario is like it's not that we are covering simply COVID-19, but it has become an all-encompassing phenomenon, and it has overshadowed all the conventional and COVID has. Since it's a pandemic situation, COVID has overshadowed all the conventional and non-conventional bits of reporting. আমি যদি আজকের আমি যেহেতু প্রিন্ট মিডিয়াতে কাজ করি, আমি যদি আজকের যে কোনো দিনের যে কোনো একটা র্যান্ডম দিনের খবরের কাগজ খুলে দেখি, তাহলে যেটা দেখা যাবে যে একেবারে ওই মানে খেলার পাতা থেকে শুরু করে সেই খেলার পাতাতেও আমাদের আজকেই আনন্দবাজারে খবর রয়েছে যে টেবিল টেনিস প্লেয়ারদের কি অসুবিধা হচ্ছে, যেহেতু সমস্ত ক্লাবগুলো বন্ধ রয়েছে, তারা প্র্যাকটিস করতে পারছে না, তারা বোর্ডের অভাবে প্র্যাকটিস করতে পারছে না। ঠিক একই রকম ভাবে কিছুদিন আগেই আমরা আমাদের কাগজে যেহেতু জীবনের বিভিন্ন দিক স্টোরি হিসেবে উঠে আসে, আমরা কিছুদিন আগেই দেখেছি কিভাবে মিউজিক ইন্ডাস্ট্রি সাফার করছে কোভিডের জন্য। যেরকম যখন ভারতবর্ষের দুটো আলাদা আলাদা শহরে, ধরা যাক কলকাতায় বসে কেউ তবলা বাজাচ্ছেন এবং বম্বেতে বসে কেউ সন্তুর বাজাচ্ছেন, সেক্ষেত্রে দুজনের কিন্তু একই সঙ্গে এই সোশ্যাল ডিস্টেন্সিং এর যুগে আমরা বিভিন্ন শহরে বসে আমরা একসঙ্গে ওয়েবিনার করতে পারি, কিন্তু মানে মিউজিকের ক্ষেত্রে, সঙ্গীতের ক্ষেত্রে যে আলাপচারিতা, সেটা কিন্তু সম্ভব নয়। কলকাতা এবং বম্বেতে বসে একই সঙ্গে it's not possible for two musicians to collaborate from two different cities during this COVID times because of this social distancing. এবং মানে একইভাবে মিউজিক ইন্ডাস্ট্রি সাফার করছে, এমনকি থিয়েটারের মতন একটা মিডিয়াম, they are also trying to adapt some digital form in order to survive. So COVID is somewhat say all encompassing. তো এই যে সময়টাতে আমার মনে হয় মিডিয়ার ক্ষেত্রে আমরা যারা মানে মেইন স্ট্রিম মিডিয়াতেও কাজ করি, আমাদের একটা খুব মানে আমাদের আরেকটা বড় চ্যালেঞ্জের কথা আমি বলবো, যে এই যে মানে এতদিন ধরে বেশ 3 মাস 3.5 মাস ধরে একটা কড়া লকডাউন হয়েছে, সেখানে বেশিরভাগ মানুষই তাদের বাড়িতে আটকে ছিল, একটা সময় ট্রান্সপোর্ট চলছিল না, এখন আস্তে আস্তে থিংস আর আনলকিং। তো সেখানে একজন জার্নালিস্টের পক্ষে আরেকটা বড় চ্যালেঞ্জ হয়ে দাঁড়ায় যে হাউ জার্নালিস্ট ক্যান অ্যাডাপ্ট দেমসেলভস টু দিস ওয়ার্ক ফ্রম হোম ফেনোমেনন। যে যে যখন যখন যুদ্ধ হয়, we know about say embedded journalists who are directly present in the in the ground zero. But in case of COVID, like it's not always possible for a journalist to be present in the in a hospital ward, but still we have to report things accurately and to do justice to say all the voices that remain unheard. তো এখন এটা খুবই একটা চ্যালেঞ্জের ব্যাপার, এবং তার সঙ্গে সঙ্গে একজন জার্নালিস্টকে ভাবতে হয় সে মানে সে খবর করতে গিয়ে there is a like there is a saying we often say that that we are there to do the story. We ourselves should not be a story. We should not ourselves be a story. We have to do a story in a safe manner, like remaining safe. That is one of the preconditions of journalism. তো এখন এইটা করতে গিয়ে আমাদের দেখতে হয় যে so that we do not infect our colleagues in office or our family members, but at the same time we need to visit places and do the story accurately. So now I think the discretion of the journalist is very important. Not for any and every story I believe he should go to the spot. Like these days when we are talking to the bureaucrats, I believe time has come when technology should be used and applied by everybody. Like just as we are having a webinar here, I believe time has come when say video press conferences, they will become increasingly popular. Interestingly, like now only during the England West Indies say test series, the England captain, he had a video press conference with journalists all over the world. I believe in that way, if we have this opportunity of say video press conferences, there might be some difficulty in asking questions or say asking questions or try to corner a particular politician or leader with say strong questions. But at the same time it will save time for a journalist. Like if he can sit at the comfort of his home and can participate in all those press conferences, it helps in some way or other. There are many cases like the discretion of the journalist is very important. And there will be times that in case of certain investigative stories, they need to be at the spot, but again in a guarded manner. They should try to they should try to maintain social distance and remain safe while covering certain incidences. But at the same time they should exercise the discretion that there will be occasions when they need not go to the spot. Like the this is one aspect. It's difficult. Like it's our এটা আমাদের অনেক দিনের অভ্যেস, কোনো একটা ঘটনা ঘটলেই সঙ্গে সঙ্গে ছুটে যাওয়া, কিন্তু এটার সঙ্গেও কখনো কখনো মানে অ্যাডাপ্ট করতে হবে। মানে কখনো কখনো at times the photojournalists and journalists, they should collaborate with each other properly. আমার একটা স্টোরির কথা মনে পড়ছে কিছুদিন আগে, like in West Bengal, a month and a half earlier, we saw that cyclone which was an additional say additional curse other than the pandemic, West Bengal had to face. Like just on the day of cyclone, on that very evening, there was a couple in Calcutta who faced hardship amidst the storm in the city for some 3 and 4 hours. The city was totally overlocked, the roads blocked with trees, and the couple, the lady was expecting a child to be born. Like she was in great pain, and after say 4 hours she managed to reach a hospital with the help of a police, and then the baby was born. Like we reported that incident after few days, but at that time, since the child was newborn, the parent, they didn't want the journalists to visit them. So what we had to do, we talked to them elaborately, say through video calls. We asked them to send photographs, and then we reported the entire thing. Like this we could do because this as print media people, we could manage to cover that story in that way. And there are other aspects also, like COVID situation is about exploring the new normal. And like every story, whatever we are doing these days, like COVID is not only an issue of health. It has manifold dimensions, and we have to do so we have to we cover it say from every
Riju, sorry to interrupt. Please wrap up in 2-3 minutes, and later we can carry on the discussion. If you could wrap up in 2-3 minutes.
Okay, this is basically.
Is he still there?
Hello.
Yeah, we can hear you.
Yeah, I'm there. I'm there. Okay,
yeah, please go ahead.
So in nutshell, like we are exploring the new normal in this COVID situation, and like in every beat, whatever we are doing, there is some reference of the pandemic, lockdown, or whatever. And there's another onus of the media, I believe, like what we did, like apart from highlighting the shortcomings of the healthcare system, the shortcomings of the government, we tried to project the COVID warriors, and we have seen exemplary feats from common people, like how they tried to stand beside fellow people, stand beside fellow citizens. The COVID warriors, I believe this was one of the owners of the media to highlight the COVID warriors. And also from the point of view of West Bengal, I would say we had say large number of say migrant workers who were outside the city, and like this time I remember like covering this year's Eid was very different. Like we talked to many migrant workers who were outside Calcutta and West Bengal, and how they were divorced from their families, and how few of them managed to reach their homes in a home. Like since West Bengal had so many cyclone hit districts, like they managed to reach back to a home which cannot call be a home at all. It was just a facade of a home. They got everything destroyed. Like highlighting the condition of this cross section of the society. That is also, I believe, an important thing which we strive to do. And this is more or less in a nutshell.
Thank you, Riju. Thank you so much. Thank you so much for wrapping it up in as many words. Like Riju is right when he says that we have in fact started undergoing behavioral changes, and it applies to everyone, not just even to the media, like he said quite rightly. So after Riju, our next speaker is Cyril Sam. I believe he's online, right? Cyril is with us. Yeah. Hi, Cyril. So Cyril, if some of you wouldn't know him, he's an independent Delhi-based journalist, and he has been doing writings about business of journalism and political economy. or you can say he writes on communication technology, and he has interestingly been documenting one important aspect of pandemic, that is job losses, downsizing in the media. So I would like to ask Cyril to start his experience and share his thoughts here, please.
Okay, so I'm going to do a screen share, and
Yeah, sure.
I think that will make things easier for
Yeah,
everyone.
please.
Is my screen visible?
I don't know if anybody else is able to see it. I can't see it right now.
You
Not
can't?
yet,
Okay.
not yet.
Not yet.
Cyril, not yet.
Okay. Hmm. Okay then. So I don't know why it isn't working. I'll try and fix it. So
Please go ahead.
So, I'm an independent journalist based in Delhi. Much of my work is around the business of journalism and political economy of communication technologies. And unlike a lot of others who've been reporting from the front lines, I've been reporting from behind a screen. And I've essentially been trying to make sense of the crisis in Indian newsrooms because of COVID-19.
Cyril, just to interrupt you, sorry. So if you're not sharing the screen, maybe you can come on video. Like currently your video is also off,
Okay.
but just try if you can share
Sure.
because your presentation, you have made a very beautiful presentation actually and very informative. So maybe you can take 1 minute and try once more to present now.
Yeah.
Cool. Okay, let me try it again. Anyway, so I'll continue. I don't know what is happening.
Yes.
So I think
it
is coming.
It's coming.
Cyril,
Okay.
I think it's coming. It's coming.
Okay,
Yeah.
cool.
We can
So
see some.
this is
Yeah.
this is what we are talking about from ground zero media coverage of COVID-19. I'm an independent journalist based in Delhi. Much of my work is around the business of journalism and the political economy of communication technologies. You can find me on Twitter at Cyril Sam, or you can get in touch with me at.
Sorry, Cyril. I think Cyril, I'm so sorry. We just have your presentation, Cyril Sam, but we can't see any slides.
I think what you need to do is you start the presentation in a next tab, in a different tab, and then you click on the
That's what I've been doing. It is
we can't see the slides. We can see you now.
It says presentation Cyril.
Separate,
it says presentation
okay.
Cyril, but the tab is not opening.
Oh, it says you are presenting your.
Okay, you start. I'll do one thing. I'll share the
Yeah.
You start.
Okay,
You
so I was.
the video. I will meanwhile start the.
Sir, Cyril would be highly obliged if you can put on your video at least.
Yeah. He will switch on the video.
We can see him.
My video is on. I've turned on my video.
Yeah, you have turned on the video. Okay.
Is my presentation up, or is it?
We can see you now.
Is my presentation up?
Now your
Okay.
It is.
no, your video is
Anyway.
on. I'm just opening the presentation in 2 minutes. You can start meanwhile.
Cool. So I was driven by.
Cyril,
I was driven by three questions, or rather two questions. One was a report that was put out by UNESCO in sometime in March, which essentially said that COVID-19 is an existential moment for the news media globally. I was skeptical whether or not it is an existential moment for the news media in India. I was also curious because right before COVID-19 came around, I was on the streets of Delhi because Delhi had just had seen a spate of violence. And I'd seen what was happening with journalists. And so I was curious, what are the impacts of COVID? what are the impact of COVID-19 on journalists themselves, the practice of journalism, and the news media ecology. And I also realized that there is an opportunity because the news media in India does not report on itself. So there was a window of opportunity for me to experiment, look around my skepticism, report around my skepticism, and dig around my curiosity. So I started something called News at COVID-19. It's an independent blog on Medium. So I'm tracking layoffs and cutbacks in Indian newsrooms there. I'm tracking journalists who've succumbed to COVID-19. I'm documenting internal communications of different news organizations when they talk about salary cuts, when they talk about these are the kind of losses that we are seeing on a daily basis or a monthly basis, when they say that we'll have to take some.
Cyril, again, sorry to interrupt.
Cyril, the presentation is on.
Cyril,
Okay,
sorry to interrupt. We can see your presentation.
So, I mean, I'm on the third slide. Okay.
Yeah, okay.
I'm on the third slide, which is titled News at COVID-19.
Yeah.
So, yeah, so I started an independent blog on Medium, which is a blogging platform, and I started tracking layoffs and cutbacks. There's a timeline of layoffs and cutbacks there, which I try and update on a daily basis. On a daily basis, I'm speaking with journalists, I'm speaking with CEOs, I'm trying to speak with people in the advertising sphere, essentially trying to understand what is happening. This is a work in progress. I would not say that this is something that's comprehensive in any way. So this, my methodology is essentially that I am collecting publicly available information in the form of announcements made by news organizations themselves, news reports that they are putting out. I am also running a survey form on different social networks. I'm circulating a survey form on different social networks. I'm trying to collect internal communications of different newsrooms. I'm trying to speak with different stakeholders, journalists, newspaper vendors, CEOs, advertisers, business heads, union leaders, PR professionals, etc., to get an idea of what is really happening in the business of news media in India. And I try and verify every bit of information that comes to me by at least speaking with three people and independently confirming every bit of information that I receive. So details. I started this work on the 14th of April. I started circulating the online survey on the 17th of April. And so far, there are 81 entries on my timeline. I've received 44 survey responses. I have 15 internal newsroom emails and around 10 public announcements by different news organizations. Now, coming to the gaps in my work, this is not exhaustive by any means. A huge gap in my work is essentially I don't have any information about, or rather very little information about what is happening in regional language media. There is a lack of official communication when it comes to a lot of regional language media and even with English language media, because news organizations have realized that putting anything in writing is essentially setting themselves up for legal challenges. The fourth thing the fourth gap that there exists is I don't have an exact number of the journalists who are affected. I have an approximate number based on conversations with different union leaders in different states and my own work. Now, the context for all of this. Now, news market in India is an extremely distorted market. News operations in India are not businesses. Most news media owners are people with political links. And this is well documented in a report that was put out by Reporters Without Borders sometime last year called Media Ownership Monitor India. What matters in the Indian market is influence matters a lot more than revenue. So you could be a loss-making unit, but as long as you're influential, there is no chance that you will have to shut your business. And because of this distorted market, there are absolutely no financial incentives in India to innovate or to engage in journalism. The revenues are primarily advertising based. TV makes more money than newspapers, and digital across board, across newsrooms, including at times internet, is a loss center. Because this is the way that the market and the market is structured, unethical commercial practices plague the industry. There is not a single news media organization, including the ones that try and project a certain kind of progressive value, that engages in that you can call a completely ethical operation. And most importantly, because this is the nature of the market, because everyone engages in unethical commercial practices, no one reports on the news media or communication technologies in India, because any form of reporting on news media or communication technologies in India is essentially an attack on the institution itself. So no one reports, no one bothers reporting on this. This is essentially, the next slide is essentially the findings of my survey. There have been 9 closures. There have been layoffs at 23 places. There have been furloughs at 2 places. Almost every news organization has seen a salary cut of some form. We've seen 4, I know of 4 news organizations that have shut down bureaus across board. At least 7 news organizations have suspended their print editions. Now, based on my survey findings, I can say with a certain degree of confidence that at least 1,000 journalists have lost their jobs in the last 3 months. I was speaking to someone from the Brihan Mumbai Union of Journalists, which is the Bombay Union of Journalists today, and that person told me that they estimate that between 7,000 and 10,000 people who are involved with the business of media, which includes journalists, people in circulation departments, people in marketing departments, sales, etc., have lost their jobs. So, I mean, we are looking at a massive job loss, which no one is reporting on. Everyone reports on Zomato. Everyone reports on what is happening in the IT industry. No one reports on what is happening in the media industry. And the next slide is essentially, yeah, at least 1,000 journalists have lost their job. This is an extremely conservative estimate based on the survey findings. Journalists in India are working without any kind of labor protections. Journalists, I mean, there is absolutely no paper trail for journalists being laid off. Journalists are threatened in batches to resign, and it happens over a period of time. For example, today Outlook asked 3 people to resign. 3 people put in their papers at Outlook magazines. Since June, Outlook has laid off 30 people. 8 people were asked to put in their papers at the Indian Express today. Since 23rd of June, at least 30 people have lost their jobs at the Indian Express. What we are looking at is also the death of newsroom diversity, because the impact is disproportionate on women, journalists of minority religions, and lower caste journalists. The logic behind women being disproportionately targeted is that women are supplementary income earners. They are not the primary breadwinners. The reason why a lot of minority journalists and journalists from lower caste are being targeted is that they are seen as problematic people, people who will raise questions, people who might not be very comfortable with the government at the center. What we are also witnessing is the death of district journalism, the death of sports journalism, the death of features journalism. A lot of seasonal stories are being ignored, but at the same time, a lot of journalists are upskilling, a lot of journalists are collaborating. I was speaking to someone from rural Karnataka the other days. This is someone who's a 40-year-old journalist who has been with the Hindu group for the last 15 years and was laid off. That person is, for example, learning how to edit videos now. He has started his own YouTube channel, and people are upskilling, people are collaborating with each other. The next slide. This is the 4th wave of layoffs across Indian newsrooms in the last decade. Things are different this time because what we are looking at is a global structural collapse of the journalism industry. Unlike in the past 1 decade where we have seen layoffs across board, this impacts all form of media and all media organizations. In the past, it was either digital media that was affected, or print media that was affected, or television media that was affected, or it was specific companies that were affected. Here we are seeing a complete collapse across different forms of media and across media organizations. This is also going to be a longer period of flux because COVID is not going away in December 2020. COVID is here to stay for at least a significant part of 2021. this is just the beginning of what is to follow in the coming months. Therefore, what we've seen, I mean, when I say that 1,000 people, 1,000 journalists have lost their jobs, this is just the beginning.
Oh my
Most
God.
importantly, these jobs are not returning.
Sorry, Cyril. Sorry to interrupt. Somebody is
And
again.
then
Cyril, 1 minute, please. Somebody is presenting. I don't know who this guy Nurullah is.
Nurullah Zardan, can you? I'll have to remove him. Wait.
Please remove him because he is disturbing.
Just a second. Sorry, Cyril. I think he is sharing the screen, so your screen is not visible.
Yeah.
Is he gone? No, he's there. Let me remove him.
But we can see the presentation, Riyaz bhai, on your.
We can see the presentation. Okay, fine.
Yeah, we
so
can
he
see it is right in the middle.
Switched it off. Okay.
Please, Cyril. Please, Cyril, go ahead.
Cyril, go on. Sorry.
So, what are the emerging trends? The next slide. What we are seeing is a lot more informalization of this profession. We are seeing the accelerated death of print. We are seeing the death of ground reporting. Journalists are working under a lot more demanding KPIs. A lot of people who I speak with are spending more than 12 hours at work. All of them are working from home. The mental health of journalists is at the pits, and most importantly, what we are seeing is the emergence of a phenomena called news deserts, because news deserts is essentially a community or a geographical area where people don't have enough information to make informed decisions about democratic choices. So we are seeing the emergence and the worsening of news deserts in India. What is next? The next slide is essentially we are going to see more layoffs. We are going to see a lot of closures in the coming months. We are going to see a lot of worsening of information inequality, a lot more of polarization, and this is essentially a fallout of pay for news model, which is emerging, which a lot of people are now trying to pivot to. We are going to see a lot of emerging media models. A lot of cooperatives are going to come around. A lot of collectives are going to come around. A lot of verticalization is going to happen. The market is going to fragment a lot more in the coming months because there will be a lot of new outlets which will come up. All of these journalists who've been laid off, many of them will start their own things. So we're going to see a lot more fragmentation of the market. The mainstream media, through all of this, will continue to command influence, but there will be a vacuum for journalism. Journalism is a subset of news. We will essentially be witnessing a vacuum for journalism. There'll be a lot of news, but there'll be very little journalism. The next slide is essentially the relevant links. I mean, you can find all of my work at these links. And you can get in touch with me on the next slide. I mean, these are the ways to get in touch with me. I'm on Twitter at Cyril Sam, and you can email me at samcyril@protonmail.com.
Thank you, Cyril. Thank you so much. Thank you so much for this wonderful presentation. And I should say this is also very important apart from the other things that we journalists do. As Cyril said that around 1,000 people have lost jobs in 3 months. And he also said that it's going to stay. Pandemic is not going away anytime sooner. So we don't know what happens in post-COVID world. Thank you, Cyril, so much. So we are, I think, Riyaz bhai, we are done with the speakers. And
yeah, we have around, we can take around, say, like you said, 30 minutes of question answer. So what we can do is, like, say, take 4 questions each time, and then like each round 4 questions, and then we come back to each speaker. But before we start, maybe if you have some question or some clarification, and then so first we'll take like, say, people who have questions, they need to write their names in the chat box, so then I'll call out the names.
So till then, should I ask some
questions? Meanwhile you can ask questions too.
So this, I'll start with something that Cyril touched, that Parth touched, and Riju also touched. So this pandemic has resulted in a huge behavioral change. Not just behavioral change, it has resulted in professional changes, in social changes. And one of the very important changes is the changes in, education. Parth, this question is for Parth. Parth, I think he had reported about Dongri in Maharashtra, where he had visited. And he had written about how this digital shift from physical classes to digital classes is affecting the rural population. I believe he had given the percentage of, in Maharashtra, I think 73% of students come from rural background. Correct me if I'm wrong. So Parth, Parth, I would like you to explain this divide. I believe that story had published in Pari, right? So would you tell us? Would you tell our viewers on how this digital divide plays? We can say that the story explains it quite well. That we can say that in urban areas it's easy for students to go online, but for places like Dongri, which is just 130-140 odd kilometers from Mumbai, how is it playing out? Please.
Yeah. No, so the place was Palghar actually, not Dongri.
Sorry.
Yeah, so Palghar is basically, I think you would remember the mob lynching that happened in Palghar, and that's when it sort of everyone was talking about Palghar. But it's a predominantly tribal belt on the border of Maharashtra and Gujarat, and I visited that place. I drove down to one of the villages in Palghar district, and you could see how lost even the teachers were when it came to the idea of online education. Because the day I reached Palghar, there was a teachers meeting, online meeting with the collector from that taluka, from the Talasari taluka that I was in. And they told that one of the teachers told me that they couldn't even get the video on for a while. There was problem with connections and so on and so forth. So how are we going to sort of translate that with students on a day-to-day basis? Now there are so many problems with having an online sort of an online learning or e-learning in a place like Maharashtra, where most of your parents and students have little resources to actually get online and study. Now I spoke to a 12-year-old girl who said, I think Nurullah is presenting again.
Yeah, he wants to present something very interesting.
I will cancel. You go on.
Yeah, please go on, Parth. You are okay. We're good.
This 12-year-old girl I spoke to, she said that my brother has a smartphone, and I familiarized myself with the smartphone. But if it's an online class, what do I do if I have a question? Would the teacher be able to notice if I raise my hand when I have questions? It's such a simple doubt, but it's something that's something.
Yeah. Basic. Yeah.
And that village where a few people have smartphones, they have got smartphones on installments. They've paid like 2,000 rupees, 3,000 rupees of down payment, and then they've paid like the next 500, 700 rupees in installments and bought a phone over a period of 6-7 months. So I think what basically the headline of my story was from digital divide to digital partition, and that's exactly what happened with online learning, because it's going to marginalize students, sideline students further. And who are these students? Basically, they are Dalit Adivasi students who have not handled smartphones before. Secondly, the problem with online education, it also put some onus on parents to keep an eye on their children, and that's because most parents wouldn't know if their children are actually paying any attention to the class, because they themselves haven't studied as much. In an Adivasi area, for example, many of the students who are going to schools are first generation students. And also you have to look at it in the context of the lockdown. Most of these parents are laborers who have not been able to make a penny since lockdown. So they have to go out and they have to make up for the lost money, lost time over the past 3 months. They can't afford to sit at home and look at their children. So I mean, it's something that is going to affect rural children, especially Dalits and Adivasis, worse. And one critical point I'd like to add is that most of those when I visited that tribal belt of Palghar, most of those who had a phone were boys and they were not girls.
Oh my god, interesting. I believe it is not far from Mumbai, right? How far was the place from Mumbai?
130 kilometers. It's just 130 kilometers. And
these are the fault lines, in this.
Connectivity is poor. The electricity is not there, especially during monsoons. The electricity keeps coming and going. So one of the tricks to find out whether there is whether you can find a good place place of network in a village is to figure out if there are a few boys sitting under a tree or or near a well, because that would be a spot where they have some semblance of network. So they would gather somewhere there and listen to songs or watch some videos on YouTube or something like that. So if you find a few boys sitting under a tree, it means that spot has decent network.
So a lot needs to be done on this digital, shift also, even in places like Mumbai, which are like 100 kilometers from Mumbai.
Because
do we have a question?
Yeah, we have question, but because I teach in a university, and on similar note, what Parth was saying, so maybe I can also experience a bit of experience from Bengal. So yes, what Parth is saying, just to add to what he said, is in most, like even in normal middle class family, say if you're not above, like say 16, 17, 18, or generally in house there will be, like say, one mobile phone, like a mobile phone which works kind of as a semi landline phone, which is there at home. And most family will have, say, 2-3 children who are school going, right, or even college going, and then the problem begins. I don't know why some people are sharing their screens.
It's over. Carry on. Please,
Yeah,
go on.
so basically what happens is, when these online classes began, so this problem came to forefront. Okay, even if you have a, say, laptop at home or a computer at home or a mobile at home, if you have two child, then who will attend the classes? And there the people who work with like on school education and all, they're saying the fear is that the first preference will be male, like male child may attend or maybe one who is more intelligent, whether it's male or female. So sometimes of that disparity, like even if you have a laptop or a mobile phone at home, you will not have laptop for every child. And then the problem like that problem, like I teach in a university where majority of the students, like say almost 90% of students are Muslims, and primarily most of them are from rural areas. And so that we are facing the problems like how to conduct classes, how to even conduct exams. And finally government had to, that UGC said that exams need to be conducted, and most state governments have opposed this decision. Even Maharashtra, even like they wrote to the education even Delhi, yes. So they had to write to the government that we can't conduct examinations, like it's not even possible. So people have been with that.
Can I ask a question to Priyanka first, or can you?
Yeah, you can ask. Meanwhile, the first question, Aragya Bhattacharya and then Kaushiki Tiwari. So two of you be prepared.
So after Priyanka, right? So Priyanka, it's a question for you. Right in the beginning of this pandemic, like in March, you mentioned it in your earlier speech. So we had this a super spreader, Tablighi Jamaat super spreader, which obviously originated from Delhi. But the problem with this was a huge vilification of this group which had gathered in Delhi. And I believe on April 18 or 19, the government of India said around 4,000 cases were linked to Tablighi Jamaat, and around 40,000 people were put in quarantine. So you said 2,000 cases were from Chennai also, right? From Tamil Nadu, for that matter. So, but there was this. I just wanted you to highlight this point. In Delhi, we saw a very bad naming and shaming of these Tablighi Jamaat, to the extent that our chief minister went on to have an FIR lodged against them. And another point was in the daily bulletin that we used to get. It used to have a separate column that how many cases were from Tablighi Jamaat, which was extremely bad, because you are vilifying people who are victims, right? So I just wanted you to touch upon, was the same kind of vilification in South India also, because South also had many cases. So can you please tell us about it?
So when the first couple of cases for the Tablighi Jamaat came, if I remember correctly, it was on March 11th when the police found an Indonesian national in western Tamil Nadu. And they were basically hiding the fact that a couple of them had symptoms, because they were scared, because there was already so much verification going on. They were very scared. So that is when they realized that something is wrong. So this particular Indonesian man, they found out that, correct, he was actually in the Coimbatore airport. and he had very strong symptoms. He was, of course, later found to be negative. But he informed the public health department that there are more people from outside the country who are residing in Erode, which is another district in Tamil Nadu. So that's how this whole thing kind of like spiraled out in Tamil Nadu, and soon more cases came to fore. But let me tell you something. A lot of the Islamophobia came from outside of Tamil Nadu, not
interesting.
in the state. So within the state, the government, to its credit, of course, said, first of all, they said again and again that we should not vilify the community or anything like that. And initially, they in fact just called it a single source infection. They wouldn't even say the name Tablighi Jamaat.
Okay.
Even in press conferences, they would say single source infection. And also, to journalists, also the instructions that were given is don't use the words Tablighi Jamaat. So, see, the way the government saw it, it was unnecessary, kind of like an undercurrent of Islamophobia was definitely there. But from what my understanding is that it came from outside the state. And of course, there are people within Tamil Nadu as well who are Islamophobic or who have certain biases towards a particular religion. There's no denying that. But to a large extent, the community was not strongly vilified in Tamil Nadu. So that is something I have to give credit to the government for. So initially, they did put in the bulletin saying Tablighi Jamaat or single source infections was this many numbers, but later they removed that as well in 2 or 3 days. The government is very careful because, of course, we have our elections next year, the state elections.
Yeah, I think this also adds. If you don't vilify them, like they would have come out and been very honest about it that we have attended this meeting. That then it would mean easy contact tracing. Otherwise, they would not come out, and if you vilify them to that extent, they will be scared obviously.
So the government, what the health secretary back then was Leela Rajesh, and she put it very smartly. She said, see, you guys have to come out so that we can help you.
Exactly my point. Exactly.
So please come out in large numbers, help us trace you. But what happened is when I spoke to a couple of Tablighi Jamaat members, they had said that a couple of days before, like the health secretary had even made a plea, some of them had gone to the hospital to get checkups because by then they knew that the pandemic was to be considered. But they said that hospital authorities turned them away. So huge number of Tablighi Jamaat members were asymptomatic. So then the hospital turned us away saying we were asymptomatic. We actually went there and said, please test us. They were the ones who turned us away saying, no, we are not going to test you. And they said over and over again, in fact, they were made to wait like for 8 hours, 9 hours, 10 hours in hospitals.
Okay, thank you, Priyanka. Thank you so much. Thank you so much.
Please. The previous question regarding education. I just want to say what Tamil Nadu government has actually done. So, as opposed to going through the e-learning route, what Tamil Nadu has done is they've launched a TV channel called Kalvi TV. So, while most of the villages, at least like majority of them are, of course, have electricity and TV access in Tamil Nadu, and of course, there's like during the DMK's period, they had given free televisions to every single household in the state. So television access is huge in Tamil Nadu. They may not have several other appliances, but they'll definitely have a television. So they've launched an education channel through which the state government is actually conducting subjects. They've given like a timetable saying at this time for this class. So, there are multiple children in a house, like the concern was raised. The child's time slot is completely different. So they can still get their learning. But of course, there are drawbacks where it's a one-way learning. But I mean, you win some, you lose some at this stage.
Riyaz, can we take up the questions, please?
Yes.
Thank you, Priyanka. Thank you so much. Thank you so much.
So, Aragya?
Yes, sir, I'm present.
Go on. Please, all of you, just a second, all of you, please be brief. Don't make comments. Like just 30 seconds question. Just ask the question. And please name the speaker whom you are addressing the question.
So actually, initially my question was to Kunal sir, but later I thought to shift the question to everyone, to all the journalists who are working. So basically, my question is that all the journalists who are working on the ground from point zero, it's the fact that some of the cases came that some of the information came that few journalists were affected by COVID-19. So, sir, it's my question is that how they are later being accepted to the society, means not only to the society, many of the journalists are losing their jobs. So, how is their acceptance and how are they being seen from the side of the society.
Okay. Should I answer or somebody else wants to answer?
No. Take 4 questions and then we'll come to like
Okay.
otherwise it will
Okay.
be
See.
like okay.
Okay. No problem.
So next is who. So I had said the name. Next one, are you there? Again, Nurullah Zardani.
Nurullah is again.
And the next
Anyone?
was Kaushiki
Yeah,
Tiwari.
Kaushiki Tiwari, are you there? I am actually muting Nurullah. Kaushiki Tiwari, are you there?
Sir, I have a question, sir.
Okay,
Sir,
you go on. Go on.
Sir, what is, sir? I am from Odisha, sir. Sir, what is
What's
the
your name?
sir? Dr. Pranavananda Patushi. Dr. Pranavananda Patushi, sir. Dr.
Okay.
Pranavananda Patushi.
Okay.
Yeah,
Okay.
we got your name.
Sir, what
Go
is
on.
the what is the alternate solution for online classes? Where where the connectivity is a major hindrance? Where connectivity is a major hindrance, what is the solution for online classes?
I think journalists are not equipped to answer this question. I think this is a as a teacher, I can say that this is a pandemic. So we have to wait. Actually, what we are trying to do is in the time of pandemic, we are trying to have a normal life, which is not possible. So we need to wait and see. Like those of us who survive can have normal classes. But I think online classes are here to stay, and slowly everyone need to adapt to it. Okay, we'll have this is sorry, but this is a different discussion. Let's ask the questions to journalists on their topic, and then we'll come to this later. M.A. Rahman. M.A. Rahman.
Okay, sir. Kaushiki, am I audible?
Yeah, you are
Kaushiki is
audible.
there.
Okay, Kaushiki, wait first. M.A. Rahman is asking his question. M.A. Rahman, go on. He's not. You are not audible. Sorry, wait. You are not audible. Kaushiki, go on.
Okay, so my question is to all the panelists. In metropolitan cities like Delhi and Mumbai, is it incapableness of information, then what could be the remedy for the places like Bihar and UP, where it's very easy to start journalists and even to
Your voice is not clear. Please type your question so I can ask. Okay, please type your question. Actually, there is this. Is Ashraful Laskar there? Okay, so Ashraful Laskar has written a question. I am reading it out. I think this is easier. People can write their question and I will read it. So Ashraful Laskar has asked, my question is to the third speaker who discussed about domestic violence. So this is to Priyanka from the perspective of COVID. And then he is writing, it is reported by some organization that lockdown will lead to uh, lockdown will lead to I'm sorry, I missed the line. Okay, it is reported that by some organization that lockdown will lead to an increase in unwanted pregnancies globally. Madam, please enlighten us the reason for the same and its effect on women. So I think there are these three. Okay, Nurullah Zardan, who has been trying to present, his question is why isn't as much attention being paid to COVID disease in India? Okay. He mean maybe, and there is this Tanya Parveen. With this question, we can have the first round of responses. How can journalists help to counter the tide of misinformation and provide correct information to the people to stay safe? There have been many rumors and fears in communities regarding COVID-19 due to misinformation or misconception. How to combat that? Everyone, please mute your phone, and so Priyanka and others can give your responses to these questions, and then we'll come for the second round. Priyanka?
You want me to start? Okay.
Yeah, since 2 questions are directed to you, so you can start.
So the 2 questions to me are about domestic violence and about how women are tackling pregnancies, right?
Yeah, no, so there are chances of like there are report it will be like pregnancies, unwanted pregnancies will be there. So like why is it happening? Like what is the
Okay,
solution?
so let's talk about domestic violence first. So
Okay.
the reason for the increase in domestic violence across the country is of course the fact that you were stuck in close quarters with your abuser. Earlier, let's say this abuser was going to work, he was going to a company to work, or he was a daily wage laborer who was stepping out to work, or even an auto driver who's actually going out. Now the hours that he is outside the house has changed dramatically. Number two is, of course, there is increased amount of frustration and increased amount of uncertainty in your life, which has increased in most households. And this means that there is more anger, there's more frustration. And in a state like Tamil Nadu, domestic abuse is already very high. So talking about it like from my perspective, what happens over here is the fact that your daily earnings are disrupted, the fact that you don't know what's going to happen in your future, this is aggravating violence further. And you have an easy target in the form of the woman who is in the house. Somebody to take out your frustrations on is how people are seeing it. And like there is more domestic violence definitely across the country. But let me tell you something. In Tamil Nadu, the figures that I reported recently, the police claim that the numbers have come down as compared to the same months last year. But honestly, I spoke to activists on the ground, and I think it's quite impossible that this is the actual truth.
No, in Delhi also we have the numbers going up. In fact, WHO chief also mentioned that domestic violence
Exactly.
cases have
So
gone up globally.
In Tamil Nadu, when you have like so much violence on a regular day, how is it even possible
Right.
to believe that numbers are coming
They're
down
lying there. Like, yes.
during the lockdown? So see, number one, of course, they could be lying. Number two, I also think it's possible because women are more afraid to call helplines and inform them about abuse.
There are no complaints basically.
Correct. Or go to police stations and inform about abuse.
Yeah.
Unless it's a serious case, police are not even letting people come into the station because over 1,000 policemen in Tamil Nadu, over 1,000 to 2,000, I think, have been infected by COVID-19. So they are keeping their distance unless it's a very serious case of, let's say, murder or something like that. So how this has to be addressed is what the police are also doing proactively in Tamil Nadu is they have created a database that over the last 3 years, what are the domestic violence complaints that they have got and who are the harassers. So they've been calling every single of these houses to talk to the women there. And like how they talk is they won't say, Acha, Bolo, tell me what's happening. Are you being abused? That's not going to work. No, they're not going to say, yeah, I'm being abused when somebody's like right next to them. So what they do instead is they tell them, like they say yes or no to the questions I'm asking. So the police have been quite proactive that way. They've been going to these houses and getting, like figuring out, making sure that women are safer. But even given this, I feel like the data right now is not enough. And it's very, very important to focus on this particular issue. So that is my answer for your first question. The second question about pregnancy, that's actually a very, very important issue that we need to look at. Of course, there have like several reports have shown that intimacy between couples has increased globally because of the lockdown, and let's say in a lot of cases they don't have pretty much else to do. And so at this point of time, the fact that there is not enough access to abortion pills, there's not enough access to morning after pills, and a lot of gynecologists across the country have closed shop. They've all closed their clinics because they don't, unless it's a pregnancy, they don't actually see patients and make sure that they're conducting any kind of appointments. Because even to go to a gynecologist or the gynecologist to check you, you need to get a COVID-19 test. So the doctors are insisting, even to extract a tooth right now, dentists are insisting that you get a COVID-19 test. So that's how important it is for doctors to make sure that you're not infected. So most doctors who don't see it as an essential service have closed shop. So women are not getting any access to reproductive healthcare. And earlier, even if they had like access, especially in rural areas, even if they could go to the primary healthcare center earlier, now they can't go because the officials there say that there's possibility of them getting infections if they come to the rural healthcare center, because that is the first point for also COVID-19 patients in that area to go get a checkup. So I think one of the most prominent issues is women's reproductive healthcare, but this is not at all being addressed. It is not at all like up for conversation in mainstream media or by the government itself. So this is something we need to actually focus on, because this could lead to several complications as we go ahead. And like several of the journalists here said, this is not going to end with 2020. We can't say, okay, after December, I'll take care of it. Like Mr. Cyril, I think said, it's going to consume a huge part of 2021 as well. And how long can we delay healthcare for women or looking into domestic violence against women? So I think that's the question I will leave you with.
So I anyone wants to respond? Otherwise, I'll go to next round of questions. So Madhubanti Mitra and then Sharmila Shaharoy. Madhubanti, go on.
Am I audible?
Yeah, you are.
I've already typed my question, but then I'll just go ahead. My question is to Parth, sir. So my question is, you've been covering places in Maharashtra where Dalit people, they're already facing, they're struggling with sociological challenges. You only mentioned, how they are struggling with online classes and everything. So do you think this outbreak of the pandemic that we are in the middle, is it going to bring back the discourse of untouchability for them?
Yes, I mean it has, or it is going to bring out, or it has already brought out some of our worst practices of casteism and classism. The way I saw the police officers dealing with migrant workers, for example, asking them very rudely to stay away and talk. And the way we have been practicing untouchability. It is going to bring out some of our worst practices. There's no doubt about that, because basically the idea of social distancing or physical distancing is kind of it's related to that. It's related to untouchability, and we have to be careful and more sensitive and aware of how we are going to deal with it, because we have to maintain that physical distancing, but at the same time we have to be sensitive to the fact that how we are conveying that conveying, or rather explaining how we plan to maintain that physical distance. So I think it is going to
I think what Parth is trying to say is that marginalized people will become further marginalized. So that's where the balance has to be made. Right.
Yeah.
Sharmila Shaharoy.
Yes, sir. Am I audible?
Yeah, go on.
Sir, there is digital divide. Apart from that, some people have access. I would like to say the middle-aged people. They still have access, but they don't want to convert to the digital. Still they stick to the print and all. So how can digital be the future? Because there will be an imbalance of information due to this.
Okay, who wants to take this up?
So this is you're talking about digital media, right?
Her question is older people still largely they are not so much digital friendly, and now future is digital.
Not only older people, even the middle-aged people, they even still they have access, but they don't want to convert to the digital. They still enjoy the print one.
Yeah, I think there are sections of society which are reluctant in shifting to digital media. They are still used to old newspaper model. Like there are people who don't have their breakfast without a newspaper in hand. We saw it in pandemic in 3 months when first few months we didn't get the paper, and it was very difficult for us also. But then things evolved by the time. There was a time when people said radio is going away. There will not be any radio because when TV came. But today we see radio is evolving. We have FM channels. We have podcasts. So things change with time, but that doesn't mean an older medium of communication dies. It may get less response from people, but then it is always good to shift to another medium while old mediums still remain. I mean, it's a natural process. I don't think it has anything to do with their habits, because eventually generations will come and they will eventually get used to digital things. You see children getting used to mobile phones nowadays. It was not a case 20 years ago.
Okay. I think. Yeah. So I have a question for Cyril, and then maybe I'll read more questions. So Cyril, you were talking about how there will be more media, like new enterprises, maybe smaller startups and all. But at the same time, you said how there will be news vacuum. I understand the contradiction you're trying to make. But could you elaborate on how, like, anyway, like before even pandemic began, this not work from home necessarily, but reporting without going into the field was becoming the sort of new norm in at least in newsrooms, right? Without going to a SAM, you file stories and all. So do you like, how do you see this? Like, how will this impact journalism in future?
I mean, it goes. I mean, there are two. I would say there are two ways of thinking about this. One is going back to the question of who's a journalist, which is a very existential question that you have to deal with when we talk about digital media, because it gives you the ability to report about anything from anywhere if you have access to certain kinds of evidences. So, for example, there are people who are sitting in Delhi who are reporting about things happening in Bihar, things happening in Assam, and what they do is they have a network of people who send them videos, who send them evidence, who send them documents, and they report from Delhi, sitting in Delhi, what is happening in Assam. I can do that from anywhere in the country. I could possibly be sitting in some village in Himachal and I could be reporting about what is happening in Tamil Nadu if I have a good enough network. So that is going to happen anyway. But what is also going to happen is that for a large part, journalists are disconnected from the ground, especially if you talk about journalists in Delhi and Bombay, which constitutes the bulk of what is called the national media or mainstream media. That division is only going to increase further. What we are going to witness is a lot more distrust because of this about the mainstream media. The definition of mainstream media, I mean, I guess it's open to interpretation, but then people don't trust the media as sources, as people who are talking on their behalf, unless it is a crisis. In most cases, we don't talk about people around us. And that divide is only going to increase. That divide between journalists and people on the ground is only going to increase with tactics such as this, which make a certain kind of reporting easier. It makes content production easier. But journalism is also about communities. Journalism is about bringing people together. This doesn't bring people together. It only generates content.
Okay. So I think we are like already over 2 hours. So what I will do is I will like quickly read. All of the speakers have, I think, notepad with them, I hope. So I'll quickly read all the questions, and then every speaker can respond in like say 5-7 minutes each. I think that's fine, Jeelani bhai?
Yeah, that's
so
let's keep it 2 minutes.
Yeah. So 2-3 minutes. I think someone is calling Jeelani bhai, so he is worried. So I think there was this question which all of you had missed. So I'm just repeating. You can note down. How can journalists help to counter the tide of misinformation and provide correct information? And the reason she's asking this question, this is Tanya Parveen, is because there are on WhatsApp and on all other social media platforms, there are so much of rumors about how of course about like how you can cure COVID, or like what hope remedies you need to do, and all those kind of information, but also other kind of propaganda. That's Tanya Parveen. Then we have a question about online classes. If anyone wants to take it up, they can take it up. Online classes, an alternative to this. Then Tabassum Bano, she has asked that is it like we talked about, briefly touched upon Islamophobia. Her question is, mainstream media like Republic TV and Z News spread Islamophobia, and how and like say she has mentioned about Tablighi Jamaat, and how do we counter this? Like how do media counter this? Then the Vipul has a question that his question is directed to all speakers. In fact, do journalists face any type of political pressure in terms of what to present and what not to? Some of you have touched upon this, but you can elaborate on this. Then what challenges are reporters facing while covering the news regarding COVID-19? How how much free is the press currently in the pandemic? This is Lahiri Mukhopadhyay. Then do we have more questions? Yes. How do journalists combat during the situation as they always face it in the front? Like, how do you face these challenges? Bishwajit Sarkar, no, he's just saying it's a nice session. Yeah, Kaushiki Tiwari, she was trying to come in. When the metropolitan cities like Delhi and Mumbai are facing incredibility of information, what about the states like Bihar and UP? So we talked about, I think here I can mention that I got one mail and that people said only major cities you are covering. Why not journalists from smaller towns and villages? And my response, I think I can respond here, is that in one session we cannot cover all, and I hope to have this series and maybe in future, but other like say Parth can especially take this, because and maybe also Priyanka or even Rijuda and others, that because you work at some position where you are reporting from say rural area also, or migrant stories, or like say Priyanka is bureau chief, so she's getting stories from rural area, and how do you like deal with it? Madhubanti has already asked her questions. Okay, there is this Arup Ratan. He is saying all journalists here, anyone can answer. Don't you think that the role of media is quite Islamophobic? Okay, it's same question basically. Cyril, you have one question for you. Do you think that the schools and the colleges in Delhi in open in the month of October? So if you have information. Okay, M.A. Rahman, when people are not being affected that time, then the lockdown was, okay, M.A. Rahman in short has a question that lockdown was probably done in India quite early when there were only few hundred cases. Now we have, yesterday we crossed 10 lakh cases, 1 million, and now like people are supposed to go to offices and all. So how do you deal with this? I think, and Mohana has one question. My question is to Parth. The agrarian crisis has been building over quite some time now, but can we attribute other structural issues to the growth of casual laborers? What do you have to say about government's inaction in this regard? I think that's it. Like these are 5-6 questions. You can all can respond in like say few minutes, whatever time. Maybe we can begin with. I don't know. The moderator can decide. So we one by one, all of you can respond.
The last question and which is directed to Parth, right?
Okay, yeah. So maybe Parth can start, and then all of you can respond. Is Riju there? Riju Basu? I think he has left. So Parth can begin, and then we'll go to Priyanka and Cyril.
Yes, as I briefly mentioned in my opening remarks, that the migrant crisis or the agrarian crisis has been building up for a while now, for the last 2.5 decades, and we haven't done anything about it. And largely, it's because our policies are so urban centric. We are so sort of obsessed with GDP and growth that we don't really focus on whose growth exactly that we are talking about. Because what has grown for the past 20 years is, I think, inequality more than anything else. So I think the governments, it's not an accident that the governments are not looking at rural India. It's a design that that marginalizes them further in order to sort of please a certain section of the society, and that's I think coming through our policies as well. I mean, if you look at a simple something as simple as education in rural Maharashtra, for example, and I'm sure the situation is similar across India. Just look at the budgets and allocation of budgets to public education in that state. It's declining consistently over the past 10-15 years. And what it basically does is it makes some of the most some of your rights exclusive to the certain section of the society, whether it is education or healthcare or any facilities that you talk about. They've become a lottery and not a right as it should be. So I think I can go on about the inaction of the government, but I don't think it's by accident, but I think it's by design.
Design. Okay. Priyanka, Riaz, wait.
Yeah, Priyanka. Yeah, next Priyanka.
Will she be?
So I noted down your question. So let me just quickly answer it in 2 lines each. So you asked, how can journalists help counter misinformation? So let me tell you something. As journalists, we check, we double check We actually talk to multiple sources before we put out a story. Because at the end of the day, it's our name on the story and our credibility is at stake. So we take a lot of effort to put out the right news. And let me tell you something, when it comes to fake news or misinformation, a lot of the a lot of responsibility also lies on the community, on people as well. As journalists, of course, you have alt news, News Minute, you have every single newspaper organization tries its best to not put out any kind of misinformation. So I think at some level, if you receive a WhatsApp forward, you look at that message, you take 2 seconds to think about it before you go ahead and forward it to somebody else. I think some amount of responsibility should be with people, and they need to realize this. Like this, they're very trigger happy forwarding messages to their entire family. Like family groups have become like cesspools for fake messages. So if you think something is wrong, Google it immediately. Like figure out whether it's fake and actually confront the person who sent it. Ask them, what is your source of information? Is this correct? And the second question was about reportage in rural areas right now. Let me tell you something. For a reporter, it's heartbreaking when you're not able to go on the field, not able to do ground reports. I can't think of anything worse than that. Because I'm sure all of you heard about the Satankulam custodial deaths here in Tamil Nadu. And like to actually sit in Chennai and have to report on Thoothukudi, honestly there's nothing more frustrating than that. The fact that I'm not able to go there, because I know if I go there, I have to be in home quarantine for 14 days. So what is the point of traveling there? And I'll be putting a lot of people at risk even if I don't follow that. So frankly, at this point of time, like Mr. Cyril has said, there are going to be like a lot of lack of reportage across the country because we are unable to go to the spot and get information. And rural areas are like treasure troves for stories. Like they are for reporters. That is where you understand the basics. That is where you can actually, learn how to report on several basic issues. And I'm sure Parth will be able to.
Ground reporting holds the key. There is no alternative to ground reporting.
Exactly. There is like even fake news. If you want to bust fake news, and if you can't go on the ground and figure it out, I feel like the reporters are
the only way to bust the best way to bust the fake news is the real news.
Exactly. So, you're handicapped if you're not able to go on ground.
Can I make one short pointer?
Yeah.
As Priyanka said, the problem here is that to counter fake news is an uphill task, because those who are writing real sort of authentic news don't work in popular medium, and the ones who are spreading fake news are sitting in TV studios that are watched by millions of people. So to be honest, I don't want to sound bleak or cynical here, but I don't know how we writing for websites can counter something that's written, rather that's being said on a TV channel that's watched by millions. So it's a scary situation right now, and frankly, it's just you don't know how you can if you can match up to that scale of countering fake news, because alt news articles are shared quite widely, but still when you travel through some of the interiors of Maharashtra or UP, Bihar, the regional media and the Hindi media's impact and reach is just phenomenal, and you can't counter that with online stories.
In fact, during this custodial death, there was this huge hate campaign going on because the victims were Christians. So there was some kind of religious thing going on there. And when I forwarded stories to people, I had people replying to me saying, but what about the rape allegations against these 2 men? So that's the kind of penetration, like there's no proof, there's no like rape case against them. That's what people ask you. They would rather, like it's also about what people want to believe, I think, at the end of the day. Do you want to believe that piece of information they're getting? So going to the next question.
Somebody mentioned some channels, doing Islamophobia or other sensationalization. I would suggest stop watching those channels. Simple.
Yeah.
At least that is your bit, because it's rightly said, it's humongous. You can't counter it by your little amount of resources. So at least you can do your bit by stopping watching those channels. At least their one TRP guy is less.
So do journalists face political pressure? Yeah, but not directly. We don't have like in rural areas. Of course, politicians call you directly and threaten you.
Can I intervene here? Can I intervene?
Yeah,
Teresa Rahman. Teresa Rahman. Many of you might know. She's a senior journalist. She has been there all through. She is making an interesting point. Teresa, can you listen? Can you listen to hear me? Teresa, are you there? Okay, can you speak or you want to speak? She has made an interesting. Yeah.
Is off. If she
Okay,
can.
her mic is off, so I'll just read. She has written that I think the COVID is opening up new vistas in storytelling. So this is like a different perspective. Marginalized communities are using digital media, especially videos, to tell their stories. And we saw how, like this Shramik Express, they were making their own videos and it was being circulated, and that's how we got to know many of the things. We are getting more hyper local. We are getting more hyper local news from remote villages and towns in Northeast India. So this is an interesting point actually with the new media, and because of pandemic, we can have actually news which like very hyper local news also, right?
That is true. That is true. Because we know, as a matter of fact, for us journalists, worst of the tragedies are the best of the opportunities for us. So that is what has happened in COVID as well. So we may be this is bad, whatever is happening, but at the same time, news coverage has gone to a level where you can do. Even if you don't have this right now, what people are doing, they're not able to do WhatsApp calls. For example, somebody mentioned about Kashmir. People are not able to do WhatsApp calls because of the 2G thing. But now what they are doing, they are recording those voice messages and sending them across. That is another latest medium of sending across the news. So I think it is evolving day by day.
If I'm going to play the devil's advocate here, the fact that you get very specific information from areas that are otherwise not accessible, I think that is also quite problematic, because you're only hearing one version of the story and it becomes very difficult to get the other version in this current.
That earlier the panelists also highlighted is the communication from the level of the government, as you said, in Chennai, in Delhi. So it has been a one-way communication. So that is the biggest problem that we face. So had government been more transparent and more forthcoming, things would not have been so difficult for us.
And there's a general distrust of what authorities say, right, across the country. You're not ready to believe all the figures and the facts that they are offering, even if sometimes it may be right.
Cyril, do you want to come in?
Okay,
I think we are almost like
I'll
two and a half
about,
hours. After Cyril will, so we are almost like 2.5 hours. I can continue, but I think slowly people will start leaving. So maybe if Cyril,
we are losing the numbers. We are losing the numbers,
Yeah, that's what I'm saying. So we were 100 all through. So now we are 66. So Cyril, 5 minutes, and then we wind up.
Yeah.
So I'll talk about misinformation, Islamophobia, and fake news and all of these things that people raise. And maybe if I have the time, I'll also get to what Teresa was saying. So first thing is what we're dealing with is something which is very systemic. We have a ministry that promotes pseudoscience called the Ministry of Ayush. We have the Prime Minister, the Home Minister. These are people who are making dog whistles. They are essentially people who are making Islamophobic slurs. In that, if we think of how journalism functions within a certain sphere. I mean, there's only so much that you can do to hold the government accountable. If the government is unashamed, if you can't bring in any kind of shame to the government, there's very little that you can do. And that is what we are seeing across different countries when it comes to the level of impunity and the level of pseudoscience that different leaders are promoting. They don't care about what science has to say. They don't care about what experts have to say. They don't care about what people have to say. And we've reached a point where journalism can no longer hold people accountable, especially people in positions of power, because they know what keys to turn to control journalists and journalism.
They have been also.
So we are dealing with a systemic problem. When it comes to, say, fake news on social networks, I have numbers from 2016 because I was very interested in disinformation at that time. So if it took you ₹1 to promote a fake news story on Facebook, it took you ₹4 to promote a fact check. So that's also how our communication systems are designed. They are designed to promote a certain kind of narrative. They are designed to promote fake news. So, I mean, we are dealing, again, I'll go back to what I said earlier. We're dealing with a systemic problem. Third thing about, it's not just Ayush. You have the PIB fact check. PIB fact check counters every critical story that is published about the government of India. Everything critical about the government of India is fake news. So we're dealing with a huge systemic problem here. There's very limited resources that journalists have. There's very limited things that journalists and journalism can do itself. The third thing about press freedoms, I mean, if you look at India's press freedom index in the last 6 years, in the last 4 years, we've fallen 6 points on the press freedom index. During the same period, we've fallen 10 points on the democracy index. Again, it is a systemic problem. Between March 24th and June 18th, I think 55 journalists were threatened, booked, or intimidated by various government departments, according to a report that was put out by the Rights and Risks Analysis Group. So that is, on an average, 2 journalists were picked up, threatened by different authorities every 3 days. Every 3 days, 2 journalists were being threatened with court cases, police cases. There were either cases booked against them by various state departments. Again, there is very little that journalists can do here. People have to start demanding accountability. Journalists can only demand so much accountability when leaders are shameless.
Is that it?
Yeah, that's it.
Yeah.
So I think with that, we should wind up. So Madhubanti, because she teaches at ILITS, it's a journalism school in Kolkata, and she's also a PhD candidate at Aliah University in my department. Actually. So yeah, go on.
Thank you, sir, for this wonderful introduction. So this was an amazing session. I mean, with the most amazing panel that we could have thought of right now. And in this 2.5 hours of discussion, we have actually touched upon, various elements of our social and cultural spheres in terms of COVID-19. And, we've looked at it from the lens of the fourth pillar of our democracy, that is media. So I want to thank you all, and I want to offer my heartfelt gratitude to all the panelists, who have enlightened us and, in an articulate manner. So I'll start with Mr. Jeelani, sir. So you've been, chairing this session, and you've been a, very inspiring speaker to start with, and we've been directing this session with utmost dexterity, and we must commend on that. So thank you for being a part of this session, sir. I would go on to thanking our other panelists, Ms. Priyanka, Thirumurthy ma'am. You've been enlightening us with your speeches and how you've spoken about it. You've made it come very, very alive in front of us, all the struggles and everything that you've talked about. Thank you so much, ma'am. We'll move on to Mr. Parth, sir. So you've been enlightening us about things that we scarcely get to know about. So that has been very enlightening, and we've been inspired. Thank you so much, sir. I'll move on to Cyril Sam, sir. You've been talking about digitization of journalism, which has been a part that we all have been trying to figure out through this COVID-19 process, and your inputs have been really commendable and unparalleled. Thank you so much, sir. I would also like to offer my thanks to Riju Basu, sir, and Padma, Priya ma'am, who've left this session, and my heartfelt gratitude and thanks to all the participants who've been a part of the session, and you've helped us to make this a success. And definitely, last but not the least, my heartfelt gratitude goes out to Riyaz, sir, who has made this, who's planned this and made this become a success. Thank you, everybody. Thank you so much.
Thank you. So I think I must especially thank all participants, except one or two hassles. Most of them have kept their mobile on mute, mobile or laptop. So I must thank them. This is actually a new medium, so we are also learning. So these kind of things will come up. Before ending this, I must say that tomorrow also we have a session, and like today we had from different Indian cities, and tomorrow we have from South Asian capitals. So I invite and I request all of you, the speakers, also the participants, to join us tomorrow also. And also I hope that we can continue this in future. Most of the speakers except Gulam Jeelani and also with Sam, like I contacted them for the first time and they were quite forthcoming. I'm really thankful to all of them. With this, I think we conclude and end this session. Thank you so much.
Thank you so much. Thank you so much, everyone. Thank you so much, everyone.
Thank you, sir.
Thank you for having us.
Thank you.
Thank you.
How do you close it now?
I can still hear you, Jeelani bhai. ठीक है, मैं बंद कर दे रहा हूँ. हाँ, thank you.